Good morning and welcome to the second day of the Global WHO AI Conference on Shaping AI in Health. Yesterday, we had some interesting conversations about the role of leadership in AI governance and how to move from pilots to implementing at scale. Today, we will shift the focus to the ecosystems. How do we build ecosystems for sustainable and responsible use of AI in health? And how can we leverage cross-country collaboration and ensure targeted investments? To set the scene for this exciting discussion on global collaboration, it is my pleasure to welcome Ursula Zhao to the stage. She is a technical officer in the Department of Digital Health and Innovation at the WHO headquarters. Ursula, please, the stage is yours.
Bon dia. Good morning, distinguished delegates, colleagues and friends. So before today I talk about implementation, capacity building or governance, I would actually like to start with a story. Not a long time ago, Aishwarya, who is an Indian entrepreneur, female Indian entrepreneur, developed an AI-enabled sensor glove to help the people with a hearing loss, but especially deaf mothers, including her aunt, to be able to communicate freely and independently with the world around them. The design behind this technology is very simple. The hand movement will be captured through the sensor and then transformed into digital signal and then translated into English or Hindi, and then finally spoken out loud in real time. This small-team entrepreneur has the passion, has the determination, has the technical expertise to develop a solution that could really potentially make a change to especially serve the community that is usually underserved and usually overlooked during the entire process of AI design. But they're also facing a problem, and this problem is not unique to them. It's actually a problem faced by many innovators and entrepreneurs in this world. How could we actually prove and validate that the technology is working? How could we actually measure and evaluate the safety and effectiveness of this tool? And where and when should we file the IP claims? And where we could find investors and users and government to support it. But most importantly, how they could actually take a leap to move beyond pilot to really develop a solution that could benefit millions. And their opportunity came in the form of a participation into a joint workshop co-organized by the World Health Organization, the International Telecommunication Union, the ITU, and the World Intellectual Property Organization, the WIPO. Last week at the AI for Good Summit in Geneva, this small team was invited to present what they have found out and what is their concern and their challenge. So suddenly they found themselves around a network that is much bigger than their usual one, and it's really a long list of actors that they're talking with. The investors, the researchers, the regulators, the IP experts, the clinicians, health workers, but also the global institutions like ITU, WIPO, and WHO. So what has changed is not only their visibility, of course, but it's also about the ecosystem around them. And many people, many delegates have already said this before, yesterday in the meeting. Right? AI cannot scale alone. AI can only scale when there's an ecosystem built around them. So if we would like to help many entrepreneurs like Aishwarya, mentioned here, we need to have a list of actors to build up this entire ecosystem around it systematically. As said before, we need researchers who could actually help validate these solutions across population, in different multi-site, in different countries. We need the regulators to help us to really build up this guardrail framework to protect the population, meanwhile enabling access. And we need investors who are willing to invest not only shining objects, but also the unglamorous, as Alain mentioned yesterday, the unglamorous system around it. But I think the most importantly, we need community members from different associations, from different parties to help us build the trust. But this is why I think implementation is not a purely technology problem. It is also a collaboration problem, and this is why we're here today to talk about it. But I would like to spend one more minute to talk about a little bit really the reality of all the AI solutions today. I think this entire graph shows why collaboration is important and why not a single institute could hold all the pieces together. Make an example. Think about, in your mind, think about one of the AI solutions. I would think about a portable ultrasound, right? This portable ultrasound, the models inside and the data based on which it's trained probably is held by one institute in country A. And when it started training the model, the computing infrastructure is probably located in country B. And then when they move forward to do the validation process, these exercises will take place in different clinics in country C, D, E, and so on. And then if we look at really the upper structure, right, the IP office in each countries and each jurisdictions, territory will have a different rules and obligations. The regulatory body stays with the government, and then at the same time, high-level global governance structures such as WHO will have a different guidance published, and they will follow. So if you think about this entire chaos, actually they are all important parts to contribute each of the successful implementation of an AI tool. So if we think about it, that all the pieces from each of the AI tool is scattered, but the responsibility is definitely shared with everyone, right? To protect the patient safety, the privacy, to really ensure the effectiveness, ethical and equitable deployment of each of the AI tools. So in what way we could actually work together as a whole to really fulfill this shared responsibility inside this entire chaos? And I think this is why I would like to talk about a few different vehicles that the WHO has already been doing for over a decade. The first one is the Global Initiative on AI for Health, and this initiative only started July 2023, but it was not from a draft zero. As a matter of fact, they started already back in 2018 in the form of a WHO ITU focus group. And this group was created with the mandate to really look into creating benchmarking for different types of AI solutions. And by the end of this mandate, in July 2023, this focus group upgraded into the global initiative, and with the joint participation from the third UN agency, the WIPO. So currently, this is a tripartite collaboration coalition together to really support the responsible use of AI across different UN environment, but also support countries. And the most important building blocks are enable, implement, and the facilitation. And under each of the, and under this global initiative, there are currently also 5 active working groups for cross-cutting areas, as you can see on the slides, and the experts showing here, and I see some of the faces here, actually is part of a member of this working group. And then also we have 8 different particular disease or topic-specific group for women's health, for traditional medicine, and for primary health care, and some, life course or malaria. So there are different topics, areas that is currently in the reconstitution. And also, we have published a series of documents since the recreation of the global initiative. Of course, starting from the foundational guidance on the ethics and governance of AI for health. And I was very happy actually to hear about the Professor Changcha yesterday about, about how to really implement the high principles of ethics. So under this guidance, actually, we also have a checklist specifically asking the question for the member states, for the health workers, and for the programmers as well. And then we also had published the particular topic-specific document, such as the mapping, the application of AI for traditional medicine. But also, just last week, I actually took a copy here, we also published a new document and led actually this time by WIPO, our partner, on the AI-enabled innovation IP from idea to impact. And this time, actually, which is very important and very interesting, is really focusing on helping these innovators like Aishwarya to really understand what are the IP considerations throughout the entire innovation journey. And the many problem they're facing is really about when to find the IP, where to find the IP. So this is really something that is usually underlooked and underestimated during the entire AI life cycle. And of course, not only we're producing products, we also serve as a convenient platform for people to join and exchange. And meanwhile, really empowering the local capacity as well. So in 2023, we had the first global meeting, convening meeting, annual meeting in Riyadh, Saudi Arabia, to really look at the transition from the focus group to the global initiative. The second one last year in Singapore to really continuously look at the governance structure, the term of reference of each of the group. And I'm very pleased to announce that this year, actually in China, we will host the third annual meeting on 16 and 18 September. And the registration is currently open, and we will be able to share more information after this meeting as well. And welcome everyone who would like to join for this annual meeting. The second vehicle I would like to talk about is called the WHO Consortium on AI for Good. So this is actually a consortium of different institutions that come together in the name of a WHO Collaborating Center to really serve as extended capacity for WHO to serve the mandates that we are talking about. So under this consortium, we are looking into 5 different portfolios, but also with some shared work areas on the validation benchmarking, on the localization and implementation research, but also capacity building and ethics as well. So we're planning to extend this entire consortium to 20 institutes by the end of this year, early next year. So in case some of, you have a good institute you're working with or you're actually managing, we're also happy to exchange as well. The third, but the last but not least, is this AI International Regulation International Symposium, the IRIS. So this is a symposium co-hosted by WHO and the Food and the Drug, the Republic of Korea's Food and Drug Ministry. And under this entire symposium, they are actually looking at the life-based regulatory, life cycle-based regulation. So from the initial deployment to clinical trials and to manufacturing and even to the post-market surveillance. And most importantly, this symposium is not an ad hoc platform. They would like to do it as a recurring platform. So the next one is likely to take place in early 2027 as well, and really to serving as one of the most largest regulatory convening platform for people, for regulators, innovators, and the different partners to exchange and to collaborate as well. So altogether, we have the Global Initiative on AI for Health, we have the Consortium of AI for Good, of AI for Health, and we have this AI regulation, a regulatory international symposium as the 3 vehicles. And I think I would like to close my speech with, with a highlight of what we have heard from the last week's high-level AI governance dialogue took place in Geneva. So at this conference, they published a high-level scientific panel report in which all the members agreed that, first, it is time to move from only talking about AI high-level principles to implementation. It's important to see whether we could already see some of the implementation taking place to prove the tools actually work and the principle actually work. And it's important that we remember that as we speak today, majority of the member states and the country in this world are still inheriting the model that is not made by themselves, is not trained based on data in their population, and is still following the rules and the governance made by a very minority of the country in this world. So I just want to put it here. So it's very important to remember that we cannot to talk about really high-level standard if every country cannot evaluate, implement, and regulate in their own terms, right? Because even only we do that and we collaborate together, that the deaf mother we talked about before, the aunt of Aishwarya, they could eventually really, be able to communicate freely and really to benefit from all of these cutting-edge technologies, and also every health system to finally to be able to reach a very equitable effectiveness and transformative manner. So with that, obrigada, and thank you very much.
Thank you very much, Ursula. We will now move into the Morning Intelligence Forum. Please join me in welcoming Al Wolf, President and CEO of HIMSS, to the stage. Mr. Al Wolf is President and Chief Executive Officer of HIMSS, Healthcare Information and Management Systems Society. Al Wolf, we are looking forward to your ideas and how to prepare health systems for the next wave of AI. Please, the stage is yours.
Bom dia. Good morning. Thank you so much for having me, and thank you so much for being here this morning. Just a moment, if you're not familiar with HIMSS, we're a global nonprofit, an independent society with over 140,000 members across the globe. And many of you are engaged in this audience and working in different areas with HIMSS, and we're very proud of that relationship and our partnership with the WHO. Our vision is to realize the full health potential of every human everywhere, and built into that is a strong and unwavering commitment to health equity. Our mission is to reform the global health ecosystem through the power of information and technology. So let's jump into it quickly, because the challenges in each and every healthcare system are largely the same. It doesn't matter where you sit. And in fact, we have found these, unfortunately, incredibly universal. First and foremost, we all have aging populations. And with those aging populations come unique burdens, specifically around high chronic disease management. And these are growing numerically for 2 large reasons. One, as you get older, you will, in fact, ultimately have some chronic disease pop up. And secondly, we are much better today at diagnosing and predicting chronic disease than we were 20 years ago. So while the numbers are increasing, they're not necessarily reflective of a society which is getting less healthy, but it could be, in fact, a component of our ability to do better prediction and analytics. Geographic displacement remains highly critical. This often means rural or southern hemisphere or things of this nature, but there are too many people that live in the shadow of amazing institutions, but they cannot get access. So this is an access issue when we talk about geographic displacement. You could be hundreds of miles away from the entrance of a hospital or you could be 2 feet away. But if you do not have access, then it's geographic displacement. And we are all facing challenging funding priorities. This has not changed, other than there were a few countries before that had some gaps that were unfilled in terms of where they could spend their money, and now every single one of us is struggling. And we have an educated and demanding consumer who's looking up and wondering why all services can't be delivered through their phone or accessed through the internet, and why do I have to have a face-to-face encounter? What is the best way for me to receive services? And information and data, we'll talk about that and how this plays into AI and other components. But the biggest one for me is this last model. We are all facing staffing shortages, and this is growing. WHO numbers, which were recalibrated just a year and a half ago, says that we're well over 7 million and headed towards 10 plus in 2030. More exasperating predictions say that we'll have as many as a 20 million clinician gap globally if we are going to continue to perform an encounter-based paradigm where a clinician or a nurse directly needs to sit across from an individual in order to receive care. So this is a huge problem. It means if we waved a magic wand and built any hospital we wanted to build, we could not simply staff it. So this gap has to be closed. So this leads me to, what is healthcare? What is it that we really do? Now, this was something I learned decades ago when I first came into healthcare, which was the anomaly of care. Our role is to define what is ailing someone, what brings them into our office that day, to that clinic, when a person feels wrong or doesn't feel right, or we run tests to try and find an anomaly, something abnormal. And once we can define that abnormality, that anomaly at the individual level, what we do then is we put them on a pre-established care pathway that has been carefully looked at, peer-reviewed, quality assured on a global basis. That's what healthcare is. And when we can't find the answer to it, we do more and more research until we can. And that's where our research efforts come to bear. But the mass majority is a simple game. Find the anomaly, define the care pathway that's proven, and put in front of that individual the best possible care that we can provide and that we know of. Now, that is the medical model. That is where we have sat, and we've continued to evolve. We start with population health measures. Those population health measures are fundamentally targets at the individual level and the group level, which give us general principles of what to look for. It works its way all the way up to a personalization within our hospitals and our clinics that the medical model tries to get to that anomaly or the prediction of that anomaly at the individual level. And our health models move slowly. Now, over the last 10 years plus, we have seen a massive acceleration in the health model. The global app ecosystem, which is delivering new applications and capabilities that allow an individual to be engaged or to produce information and data, which then can be brought forward and utilized by apps or the medical model when it's time to engage. We used to think that the health model would merge into the medical model. That is not happening. It is accelerating so fast, and the medical model is so slow to catch up, that the health model is now creating its own ecosystem. And the question that is in each and every one of us is, do we fight it or do we leverage it? Artificial intelligence is working its way and is already very present within the medical model and that relationship at the individual level. And we really see it in 3 different levels. One, devices. Your phones carry it, little devices you wear on your hands. the ability to take blood pressure no matter where you are, 24/7, applications that help with our heartbeat, our diet, etc. All of these are devices that can be used by the medical model or at the health model level to the engaged individual. And accessibility to these capabilities continues to grow rapidly as costs come down once they're introduced. But the main bulk of where AI is being utilized is at the operational level, and this is critical. It's capacity utilization. It's supply chain utilization. These are the areas where hospitals are refining the efficiency that the medical model is using in order to really help where their capacity gaps are going to be and the predictive modeling of even who will walk through the door at that individual day. This information is not held in giant data centers. Those are fearful components. I heard that clearly yesterday. But they're really small series of applets that are using the information available to them within the facility where they sit and are utilized to do the predictive modeling for that individual facility. And then finally, there's clinical decision support, and this is where the greatest focus should be in terms of the data, the information, its source, and the predictability based upon genomic information available. This is where the scrutiny, especially of the quality committees and all of the components that we have inside our medical model come to bear and need to be focused. So with AI now seeing itself across these three levels, we're beginning to see patterns take place at HIMSS when we look globally as to what is occurring. One, AI adoption, let's just call it out, is happening much faster than in many cases policy and governance frameworks can keep up. And we will probably always trail because it's hard to predict the innovation models and how quickly they can ascend because they pivot very, very fast. Second, countries are taking definitely divergent paths. In some areas, it's all about risk management and trying to keep the risk of the priorities and the policies in bay, and for very good reasons of individual protection, data sovereignty, things of this nature. In other countries, they're taking a very aggressive innovation first. I want to get out, I want the models out there, I want them in the hands of the engaged people. We'll figure out the risk factors on the backside. And then the majority that are sitting inside, sort of a hybrid between the two. Because the last thing anyone wants to do is to stifle the innovation that can mean so much at the individual level. And health systems have been moving from pilots, the word I hate so much as an XIT person, because it just sounds so disposable, but moving from pilots to real-world development and scale. And where you see narrowing focus, like in Asia-Pac, as an example of large-scale depth versus really wide use of pilots, we're beginning to see very, very favorable results and testing coming out of it. And finally, emerging shifts towards life cycle governance and continuous monitoring, human oversight, human in the loop. We're working these things out, and they're critically important. Dr. Kim, you made a comment yesterday that at one point in time, there will ultimately be a test where someone will sue a medical model for not using AI because we know it produces better results. And why didn't you use it in conjunction with my patient? And finally, best practices will continue to emerge. There's no general consensus, but we're all monitoring it very closely for our guidelines and moving forward. And the core challenges for us will be aligning that innovation, the safety, the trust we mentioned earlier, and the clinical integration. But as of right now, on huge scale, there is not an ROI. On small scale, there is. So, where is all this leading us? Well, here's my provocative test and my provocative statement for you. We are headed towards a significant scope of practice change. Now, about 15, 20 years ago, we had a scope of practice change inside the medical model where we shifted the burden from all being about the physician to including the nurse practitioners and the clinicians. And we spread out the responsibility so everyone could work at the top of their license. And by working at the top of their license, we were able to improve access and improve quality. Great. That lasted and helped us, and we've run out of room now. We have no more to give. And what's happening in the health model is that it has been focused largely on primary and secondary prevention. There are little pieces of it that can go deeper, and the big data centers may produce the research we talked about earlier. But inside the core, inside the very core of primary and secondary prevention, this is where AI is shifting and giving us that opportunity, so that the encounters that take place are necessary. Not because you're walking into a building to use a space and 10 minutes to have your blood pressure checked. That is a waste of space. But because it's needed, and those valuable resources of the encounter are right there. You can rest assured from a physician and from a nurse practitioner when they say AI is going to replace me, the answer is no. You'll probably just be practicing at a higher level of your license. So this is it. This is the scope of practice change we have to plan for, that we have to maneuver our medical models to utilize these new tools, which is going to bring access and quality and the capability to reach individuals no matter where they are. Now, for that to happen, you have to have a strategy at the government level. You have to have a strategy at the medical level. Without it, we're back right with Alice in Wonderland and the Cheshire Cat into the seat, and she comes to a path in the road and says, "Which one do I take?" And the Cheshire Cat says, "Where are you headed?" She says, "I don't know." Well, then it doesn't matter what path you take. Truth is, we cannot waste a single cycle. A strategy must exist at the individual level, at the facility level, at the medical level, and at the state level, a strategic effort to move forward. Now, this is not about technology at this point. I can assure you, without question, that the technology will continue to evolve faster than you can deploy it. But utilizing any new technology is only successful when we bring people and process to bear. All three must be there. That is the critical element. And as you look across this region, 2 out of 3 are fundamentally in stages of AI adoption. In North America, data and security governance are the absolute key focus points. And everywhere in the globe, doctors, physicians, medical practitioners are in fact guiding forward the fundamental efforts to ensure quality and access as they should. Now, these deployment programs are now upon us, and they are in phases. You cannot cheat the system. One of the things we've learned so well in HIMSS is to follow these types of programs that are happening. We are now seeing reports and research where applications are actually outperforming diagnosis on the human side. It was the reference we made earlier. The state of Utah has now turned over a full program they'll be monitoring over the next year, with physicians monitoring AI at scale so that we can see those comparative outcomes, document them, and build trust at the human level. And those phases will be defining your activity, your strategy, making sure your information and infrastructure is in place, and ultimately measure the outcome you need to move forward. Now, we do it through a series of maturity models many of you have experienced, but what we've done with that is put it together now for AI in 121 indicators from governance, from infrastructure, and everything in between, including the EHRs. So it's here. The frameworks are here. The paths are here to be able to be followed. This is where we are. So as we come into your moment of innovation, this significant change in scope and practice, I am absolutely reminded of this lovely phrase. which is that the incandescent bulb did not come from the continuous improvement of the candle. It is all illumination, but we are at a critical point where the lights that go forward have to be bigger, brighter, and different than before in order to take care of all of the individuals on an equitable basis in our charge. Thank you.
Thank you very much, Hal, for your honest reflections and the preview of what might await us. For our next session on building the ecosystem for sustainable AI in health, I would like to welcome Salim Virani to the stage. He is Vice Provost for Research at the Aga Khan University in Pakistan and will moderate this session. Salim Virani, you have the word.
Thank you, and good morning, everyone. It's my pleasure and honor to be here and moderate this session that you all heard about. So first of all, good morning. I hope everybody had their coffee and enjoyed the talks that we had. I thoroughly enjoyed. So if we look at yesterday, we discussed strategic leadership, regulatory frameworks. We also discussed implementation. Today, in this panel discussion, we are going to be discussing that something that is as important as those regulatory frameworks, which is how do we create sustainable AI at the level of an organization, at the level of a country, at the level of a region over time. Now, AI adoption will not be sustainable if it depends only on isolated pilots. I think the last speaker talked about it, and the term that I have been using lately is pilotitis. That we all have seen, that we have these small pilots that never scale. You have short-term funding, the funding lapses, and then guess what? It remains within a department, perhaps doesn't even scale at an organization level, and what we are hoping is that these are initiatives that will scale at the regional level at least, right? So, of course, when we look at this, this requires a health workforce that is capable of taking the institution forward. You need trusted partnerships. You need strong governance. You need clinician engagement. You need engagement from the community, from the patients. And you need mechanisms for countries to work together in this particular space. So today's session will focus on workforce transformation. It will focus on workforce transformation across clinical and non-clinical roles. We heard some of that in the last talk. Institutional and regulatory capacity, national skills, how do we build collaborations across countries in various regions, and how do we lead to cross-country collaborations that lead to meaningful change. So the way we're going to do it is that we have two speakers at the beginning of the session. One is going to provide you a clinician perspective on AI, and one is going to be a patient or community voice in AI. Following that, we will have a panel that will discuss various issues that I just mentioned and see if we can have some meaningful discussion in terms of the way forward. So with that, let me introduce our first speaker, Hannah Wen Kalshuten. I hope I pronounced it right. If this was AI-based, it would have been perfect, by the way. Hannah is from the University of Basel, Center for Life Sciences, Law, Switzerland, and she is going to be talking about patient perspectives on AI. So Hannah, over to you.
Thank you so much for the introduction. So my name is Hannah van Kolfschoten. That's a big we use in the Netherlands, and by the way, also in Switzerland, so I feel right at home there. So I noticed that we've been talking a lot these days about the perspective of the health system and also that of the healthcare worker or healthcare professional, but not so much about the perspective of the patient. And I've been thinking why that is. And maybe the reason is that we do talk a lot about human-centered AI, and maybe in the end we are all patients or related to a patient, and that's why we think this human perspective also covers the patient perspective. I think that's something to be debated. I think we do change the way we look at healthcare when we actually are in need of this healthcare and are in this vulnerable position. So I think it's important that today we also take a moment to look at patient voices in this debate. So actually very recently, last month, the European Patients Forum has published a study which was based on a survey they sent out to their partner organizations. And all their partner organizations are patient organizations, so consisting of patients who come together in a community. They got 874 responses. And as far as I know, this is the first big study on patient perspectives on AI. So they asked for what patients saw as potential benefits of AI, but also about their concerns. So the good news is that we're not sitting here for nothing, because 98% of the patients see actually lots of promise in AI. And that's mainly because they believe it will improve personalized care. They will think it will lead to faster and more accurate diagnostics. And they also think it will lead to support of better self-management, which is very important for patients with long-term diseases. At the same time, they also voice in large percentages concerns about the use of AI in patient care. And 93% is very concerned about the lack of information and transparency around the use of these tools. We'll get into this later. Also a large percentage, 70%, is concerned about the lack of human empathy and the personal touch that may come with the introduction of AI. And 68% is worried about biased decisions that may come with the use of AI, mainly when this AI is developed with the use of unrepresentative or biased data. So about the first concern, this lack of information. This mainly has to do with that the majority, far majority, believes that doctors should inform them about the fact that they are using AI at the very beginning of the treatment. They also say that they would prefer to have this information about how AI is used and what it does at the very beginning of their treatment by a healthcare professional. So that means it shouldn't be somebody at the reception, it shouldn't be some kind of email you get beforehand, but really in the conversation with a healthcare professional. And also majority says that they would only trust AI if the healthcare professional is able to understand and also explain its reasoning. That doesn't mean that they're interested in seeing the model or seeing the technical specificities. There's actually only a very small percentage, 24%, that prefers this detailed technical explanation, but they want the simplified explanations. So to give you an example of this and of maybe how this concern is not accurately addressed yet in our healthcare systems is this use of AI scribes. So these are systems that record and then translate the recording into a simplified summary, or they can generate automatically patient information letters, or they can generate information to put in the electronic record. And patients have a lot of questions about this. So they want to know, am I being recorded? Is actually my voice being saved somewhere? Who has access to this? Is there going to be a nurse who can then listen back to everything I've said? And also, can I say no to the doctor that is using this? And last month, there was a study by colleagues from the UK on primary care, and they found that only 63% of doctors now using these AI scribes actually ask consent to patients using it. And if they do ask consent, then there's only a very small percentage that actually says no, which also maybe shows us that asking consent doesn't mean that we will take away the opportunity to use AI. But at the same time, we do know that information and consent is very important for patients. So the second concern is lack of human empathy. So in this survey, 40% of the respondents said that they were concerned about AI replacing human doctors entirely. And the main reason for that was that they find personal touch and human empathy very important. And we also have some studies from psychologists that show that actually AI, if you talk to a chatbot, for example, is more capable of producing human empathy. But still, and this is what we call the empathy gap, it's the inability to actually feel these emotions. And while we thought that maybe AI can play these emotions in a way that patients will still feel at ease, that is not the case, because even though the AI performs better at mimicking these human emotions than some real-life doctors do, patients don't buy that. They don't want that. They want a real human. They don't want to have simulated empathy. They want real human empathy. So that's something interesting to keep in mind. I think the main example of where this comes to play is the AI therapy chatbots that are using all over. And these chatbots are mainly used by young people. And maybe it's also something that we call the COVID generation that is no longer used to being one-on-one in a room with a therapist, but they want to chat, they don't want to talk, and in that way they feel more at ease expressing their emotions and concerns and mental worries. But there's now quite some research on these AI therapy chatbots, and one of the first concerns I think there is that we see that even though these chatbots are mainly used by young people are not actually involved in the design and testing of these tools. So I think that's important that if we develop these tools and we know that people are worried about human empathy and we know that mimicking human empathy is not always going to work, that we should also test the group that is actually going to use this. Then also in the same space we have seen some issues of people getting very emotionally dependent on these tools, and actually to the extent that they are discouraged from seeking human help. So I think that is the second lesson we should take from this survey. People care about human empathy. Let's also include them in the development of these tools that are maybe replacing this human empathy. And the third concern is about biased decisions. And we've been talking a lot about biases, and we've been talking a lot about unrepresentative data. But I would also like to take this moment to remind you that the biases do not only are not only created in this data gathering phase. You can have a very representative data set and still have a very biased model. For example, because you pay attention to the wrong proxies. So yesterday we heard that the proxy in the model was how often people visit the clinic. But that doesn't take into account that some people don't have the financial means to visit the clinic. So maybe the data set is perfect, but then the model is biased. And in the same way, we also have biases in professionals that do not want to prescribe a certain AI tool to an older patient because they think that older patient is not capable of using advanced technology, and that's also a form of bias. So just to remind you that bias is more than a bad data set. And patients here are very worried that maybe they are in this percentage where the AI was not made for them and doesn't work for them. And I think that makes sense here because they asked patient groups, patient organizations that are often part of a rare disease group, and they have already had experience with that the healthcare system is not made for their specific disease or minority. And I also hear more and more stories about people being the data outliers and the AI system is not working as well for everyone. So they want also evidence that this specific AI system is safe for them as an individual. And an example of how patients are responding to that is, in some ways, they are collecting their own data. So they say, we are part of a community of people living with a rare disease. So we will provide our data to that community, and then at least we know that if developers want to develop an AI system for us, this patient group, that data is available. So you see actually more and more patient communities that are starting their own data communities where they donate their data to the system, and then developers developing an AI tool either specifically for that disease or broader can get access to that data to make their data set more inclusive also to this patient group. And this is an idea of taking matters into your own hands, making sure you're represented, And this picture you see here is from Duchenne disease, so people who live with this disease that have created their own platform. And that's also something that is encouraged by this European health data space that's coming up, that people come together, donate their own data, and that in that way we can democratize access to maybe more difficult to get data. What patients did not really think about in this survey, or maybe it was the way the survey was set up, is that it's not only about patient concerns and patient voices and perspective, but patients also have rights, and these rights are in most of the cases human rights. And we also should really take into account these patients' rights when we're creating the systems, when we're deploying the systems in practice. And I think one of the patients' rights we've been talking a lot about is this right to access healthcare, and that should be done in an equal manner. And unfortunately, we have quite some examples that AI, while it can make access more accessible or more broadly accessible, it also has the opposite effect, with this famous example of an algorithm in the US that actually blocked access to kidney transplantations for Black patients, while the whole AI system was set up to make it more equal. So this access for everyone is really something we should keep in mind when we're designing a system or when we're deploying an AI tool. Another concern that actually we have not talked about that much on this conference is the right to privacy and the right to data protection that patients have. Because at the same time, while we're including these minority data groups in our AI systems, we also create a bigger risk for exactly these patient groups to be more exposed, because the AI system has access to these really detailed profiles about certain patients. So that's, I think, also a risk that we should weigh against the benefits, and at the same time we see that maybe there's actually this second use of a second healthcare system going on right now, with people talking to ChatGPT instead of going to a hospital, which also creates different risks to privacy than we've had before. And there are now also some examples with data leaks in that respect, that if people were typing in their medical question to OpenAI, for example, that actually these conversations would then show up in Google results. So then you have all your personal worries and medical data right there on the street. And the final patient right that we need to pay attention to is that everybody has a right to a high-quality healthcare system. And quality is very important, but quality is also more than just how well does the AI system function. So we often talk about percentages, and then we say that maybe 95% is a good percentage and means high quality. But that doesn't include every patient. Plus, we have now this alternative system. I have got it before, shadow health systems of generative AI tools, where people get sometimes dangerous advice from these tools. So how do we deal with that? So to conclude, we should really take into account these patient perspectives, and they should shape AI governance from the very design until deployment. And I personally don't think it's enough to only look at this human-centered perspective. We should actually ask real patients that are often in this healthcare system in a vulnerable position how they look at these tools. We shouldn't only look at technical excellence. It's great if you have a model that performs 100% and is outperforming surgeons, but we're still dealing with humans. And actually, it turns out that sometimes they prefer an inferior system to technically more advanced system. And we should really take these patients' rights, which are human rights, as the basis, as the foundation for designing responsible AI in healthcare. Thanks a lot.
Thank you, Hannah, for highlighting those very important issues that our patients would like us to be looking at when we look at AI. Thank you. Now, please welcome Eva Weiken, Chief Medical Officer, Department of Artificial Intelligence, Fraunhofer HHI Berlin, to share the perspective from clinicians and the healthcare workforce. Over to you, Eva.
Thank you.
Hi, everyone. Thank you so much for the invitation. So, yeah, after we heard the clinician perspective, the patient perspective, I will now provide an overview of impact of AI on practice, roles, and the patient-provider relationship. And maybe to structure my presentation, I want to do this along two guiding questions, which is first, how is AI transforming clinical practice, workforce roles, and the patient-provider relationship? And then on the second part, what is needed to enable sustainable and responsible AI adoption in health systems? And I worked many years in clinical practice in neurology, and I'm now since over 7 years working on applied AI research. So I will try to combine these two worlds in this talk. I would like to kick off my presentation with a quote from Eric Sutherland from the OECD. It came up during a conference we had on responsible AI in May this year, where he said, you cannot put the genie back into the bottle. And I think Eric is right, because you cannot, like AI is already there. We heard that it's already in our patients' phones, it's in all of our phones, it's in our workflows. So we really need to ensure that it is used responsibly. And it, of course, also has an impact on the clinician relationship of how they are seeing their work. It has an effect on their roles and also on the patient-provider relationship. And I structured this into 3 dimensions of change, which is first, AI has an impact on clinical practice. It is now used, for example, for decision support, triage, medical imaging, and earlier detection. But also it has an effect on workforce roles, because now doctors using AI have maybe different insights into how to actually diagnose their patients, etc. And also it has an effect on the patient-provider relationship. And I would like to start with the first dimension, which is clinical practice. And the reality is that healthcare workers today and clinicians, which means physicians, nurses, healthcare professionals, they work under pressure. After the COVID pandemic, they have to treat even more patients, and they have less time for this. And this is combined with a shortage of healthcare workers overall. We have heard that also, like over the conference, that the WHO estimated a shortfall of 11 million health workers by 2030, especially in low and middle income countries. And of course, AI can support this and can address some of these gaps. There are already a lot of AI-enabled medical devices out there and also approved already by the FDA, which by the end of June this year already detected 1,500 entries. And examples of AI applications include, for example, for diagnostics and treatment, language models, healthcare services, and public health. And also we've heard a lot of citizens are using AI and apps for their own health and well-being. And this is a good thing, but of course it has an effect on the relationship. And now come into the workforce roles. Clinicians, how they see the effect of AI on their work is that, of course, the explosion of consumer-grade generative AI systems has an effect on clinicians too, because they are now, for example, themselves enabled as builders, deployers, but also users of these systems. And it also affects regulatory and legal terms, which is important to consider when we think about the workforce roles of clinicians. And it also bears new risks that come along with AI use with clinicians, which is, for example, the risk of de-skilling or even non-skilling, which means that younger generations that might not be able to learn critical AI thinking, or that don't learn like the traditional ways of how to treat patients. And it is a risk that we also have like generational differences within clinics and hospitals, which could be like very challenging to deal with and also has an effect on the patient treatment. And the Clinician of the Future report is a survey done by Elsevier every year that asks clinicians, nurses, and doctors about their own work, how AI affects this already, and how they see the future with AI within their roles. And and it showed that, like, for example, their concerns are, for example, along governance gaps, that are along liability gaps, and also are along a lack of skills and training. So they don't feel really well equipped, and sometimes also not very well supported by their institutions, that sometimes also have their own concerns about dealing with AI. And coming to the third dimension, which is the patient-provider relationship, we just heard in Hannah's talk what patients, or how patients are seeing AI, and also that they are quite, using it already. And for example, nearly half of UK adults have self-diagnosed online at least once in the past year. And they, of course, like as a clinician, you want that patients are informed and that they care about their health. And at the same time, if a patient comes and might have reached or might have gained the information from a chatbot, for example, this also bears new risks, like, for example, that you have to deal with non-compliance, or that you don't, that you need more time to actually also convince maybe like patients from the evidence-based way. So you have, like, with AI, kind of a third actor in this relationship. And Hannah already also pointed this out, the role of social media, that patients, of course, and also doctors, of course, they use social media, and sometimes they also use it for health advice. For example, this survey found that 30% of people turn to social media to self-diagnose, and among the younger generation who self-diagnosed, more of the half of them did so far for mental health conditions. So we really need to think about all of these effects this has on the patient-provider relationship. And I will now come to the second part of my presentation, which looks into the role of trust and responsible AI, and actually what clinicians want, and what kind of tools, or what tools we have to address these concerns. For example, clinicians want transparency, security, and assurance on the quality of content in AI tools they can trust. And this is similar to what patients actually mentioned. And we really need to provide evidence for the value of medical AI. And it brings me now to my second part of the presentation, which looks into what kind of tools do we have to address these concerns. And one example I would like to bring here is AI standardization. So standards are not only important for clinicians. For example, in the emergency department, I worked in neurology. When a patient with a stroke came, I had the guideline I could look up to. We also had standardized operationalized procedures, and we actually knew what to do. And I think this is important for AI tools as well. And Ursula already mentioned the global initiative AI for Health. It tries to bring together like a community of people with different expertise and work towards actually a global standardization or understanding of healthcare AI standards, and looks into enablement, facilitation, and implementation. And as a particular example of this group, I want to mention the clinical evaluation of AI for Health framework. It was also co-developed and co-designed with clinical doctors and also other stakeholders in this field. And we wanted to develop a framework that is useful for clinicians, but also for regulators and commissioners to use to see like how can we clinically evaluate AI for health. This framework suggests to do this along 4 phases, and then also to consider the economic and evaluation and also the ethical considerations, and to also consider like changes in model setting or populations. And when we had like developed this framework, we wanted to see, is it really useful for clinicians, for example, or is it really useful for researchers? So it was tested in a field test in a clinical study in Kenya that looked into AI-supported cervical cancer screening, and we found that that there are some gaps in the framework that we want to like improve for future iterations. So this shows like we can actually do this in co-design with a lot of different stakeholders. There are already, of course, more standards out there, or like also other initiatives that work towards this, which is important in this whole ecosystem. And then also I want to give an example of model cards as one tool to foster transparency, which is also something that was important for clinicians. This is just one example how this could be addressed. So model cards summarize like the key data information and key performance metrics, for example, of a model, but also they summarize like the most important findings from, for example, also ethical considerations, etc. And the FDA already mentioned this in their draft guidance for AI-enabled medical devices and recommends to integrate these model cards into the device labeling. And in this publication, we wanted to look into what kind of design actually of these model cards is needed to address the needs of different user groups. Like not all of the users of AI tools need to know all the details about the ethical regulations, and regulations, etc. But it depends on the user itself. And then this is another example of a clinician model card. This was particularly developed and surveyed with clinicians to see like how does it actually work with clinicians. Does it really address their needs, their clinical needs? Do they really, how much detail do they want to know about the model? And I think it needs this kind of research and surveys to really understand the clinical needs of clinicians, of patients, to like really put this into the center. And also, which is an important topic that was also raised, for example, in the Clinician of the Future report, was that they mentioned a lack of training and education on actually using these tools. And AI literacy is very important to think about, but also like what kind of frameworks for AI education do we actually apply, or like do we actually develop, and to really address the needs of the clinicians. And we heard human-centered co-design is important. There are already standards out for this, and it is important to really work with clinicians, with patients together to develop tools that are really useful and can also be scaled. And And in the end, I would like to point out that it is important to invest in a workforce capability, to build the infrastructure and foundations to gain this, It requires rigorous evaluation, and we also need to enable co-design and practical solutions, which is important for clinicians to actually adopt AI in healthcare. Thank you.
Thank you both Eva and Hannah for very, very insightful presentations and reminding us that as we look at these AI solutions, we have to make sure that patients, communities, clinicians, and the entire workforce has to be at the center of these because they are the ultimate stakeholders. So thank you for those very insightful comments. Please join me now in welcoming our panel to the stage in alphabetical order by country. I'll first invite Ivan Rojas Granados, Assessor del Despacho Ministerial del Ministerio del Salud, Advisor to the Minister's Office from Costa Rica. Welcome. Have a seat, please. Next, I'd like to introduce Miriam Boubakri. Miriam serves as Information Engineer, Information Technology and Methods Division, Ministry of Health for Morocco. Next, I'll like to invite Michael Quinmanria, Acting Manager, ICT, Ministry of Health, Papua New Guinea. Welcome. And last but not the least, Ihor Lysenko, Director of the Digital Transformation Department in State Expert Center of the Ministry of Health of Ukraine. Now, we do have another panelist who did not get the visa, and that's Ant Intelligence, AI. I'm sure we all have one of those ants in our families who seems to know the answer to every question. So anything that our panelists may not be able to answer, maybe you can ask your ant when you go back. I know I have one of those Ant Intelligence, whom I call AI, in our family. So with that, let's start with the questions. There are three large buckets of things that we wanted to cover in this particular session, and those are related to workforce and skills. And I think we heard some of that throughout this conference. How do we improve institutional capacity and partnerships and cross-country partnerships? And then there are some questions related to equity and sustainability as we look at AI. So those are some of the things that I'd like to discuss. Let me start first with you, Ivan. And my question to you will be, how is Costa Rica thinking about skills, health workforce and managers that they need the most, and how is Costa Rica looking at it in terms of using AI responsibly, but at the same time developing the workforce?
Yeah, thank you for your questions. Also, I think that thanks for you for creating this space to exchange experiences between the countries. From Costa Rica perspective, we believe that preparing our health workforce for AI is not simply about teaching people how to use the new technologies. It's about preparing our health system to work different ways. Artificial intelligence will contribute to evolve, and the new tools we use may be completely different in a few years. That's why we are focusing less on training people to use a specific application and more on developing the capabilities that will allow them to adopt the future technologies. For healthcare professionals, the first priority is strengthening digital data literacy. People need to understand where the data comes, where the data go, why the data quality matters, and why standardized and interoperable information is essential. Without reliable data, AI cannot produce reliable results. The second priority is the literacy. Healthcare professionals should be understanding both the opportunities and the limitations of AI. AI can support prevention, improve efficiency, and help integrate care, but should never replace clinical judgment or relationship between healthcare professional and the patient. I think the AI can humanize the clinical act. The doctor spend time typing information and spend her time talking with the patient. Another lesson we have learning is that no institution can achieve this alone. In Costa Rica, we are working aligned to efforts through the collaboration between the Ministry of Health, Ministry of Science and Technology, Social Security, university, patients, international partners for developing AI capabilities that requires an ecosystem where government, academia, healthcare institutions can contribute. It's necessary change where the society sees the AI. 10 years ago, the people think when you try to digitalize the health information, the medical spend 10 minutes typing the information, where is my data, why don't touch me, don't save me. In this moment is the AI, and not the digital information. That changed how is the clinical evolution in the time. And finally, I will emphasize something that I believe is fundamental. We talk about AI skills, but that thing is technology, but equally it's important the human skills, critical thinking, ethical decision, communication, collaboration, and continuous learning is a continuous change, but these capabilities never remains. It's essential development in the people. Our goal is not create a health professional who depends on artificial intelligence. Our goal is developing professionals who know when or to trust AI, when to question it, and ultimately how to use responsibility, improve the prevention, and make health services more efficient to provide more integrated people-centered care.
Okay. Thanks, Ivan. Very quick follow-up. Do you have a sense of what proportion of the workforce in Costa Rica has been touched by these initiatives in terms of development and literacy of AI? Can you guess?
Maybe no, but it's a really big portion.
I see. Okay, great. Thank you. Let me move on to Michael now. And Michael, my question will be, can you identify the ways that Papua New Guinea is planning to address workforce readiness? Are you seeing any barriers as you're trying to deploy those initiatives at the workforce level?
Thank you for that question. Firstly, I'd like to thank WHO for the opportunity to come here and to participate and to learn as well as share our experience. So to answer your question, in 2023, Papua New Guinea conducted a digital health maturity assessment. And the assessment found that the foundational building blocks in terms of the human capacity scored 1.8 out of 5. So in PNG, we have a real challenge with digital health literacy. So currently in Papua New Guinea, we have 2 e-health governance committees that only give approvals for the implementation of digital health initiatives if the comprehensive training plans are included in the deployment of these tools by the implementer or vendor. So while this may work for the individual tools that are being introduced, this may not be sustainable for Papua New Guinea. So in our digital health strategy developed or launched in 2025, our strategy proposes a long-term solution that is sustainable to addressing the low digital health literacy by introducing digital health literacy in the curricula of health workforce training institutions, which guided by a competency needs assessment, focusing on pre-service health workforce training.
Thank you. Thank you, Michael. Iho, let me turn it over to you and ask you, anytime you look at any technology, AI is, of course, one of them. There is a big component of change management, which is a very important concept, but not very easy to implement. How is Ukraine looking at it in terms of your workforce when you're trying to do this change management?
First of all, thank you for the invitation. I'm glad to represent Ukraine today. Building skills and competencies for us is process that is critically important. Our specialists implement new technologies while living in today, because tomorrow may never come. The speed of change in Ukraine is colossal. For example, we implemented drug electronic dossiers, CTD format, 3 times faster than it took average across Europe. Our specialists are today among the world leading experts in combat medicine. And our hospitals and teams are self-sufficient, able to keep working even under completing power blackouts. So that's not theory, it's been proven by the time. Let me be direct. In today's world, you either learn fast or you gone out of the game. So that's equally true in war, working with AI, in anything modern. To be an effective manager, you need 2 things at the core. First of all, ability to learn fast. The second one is strong leadership skills. Everything else is built on top of these 2. But how do we learn in Ukraine? I can say that it's practice, practice, and practice again. In Europe, a lot of time traditionally devoted to theory and discussion. With all respect, I do not believe that it's the right approach or the right place in 2026. Theory matters, but it matters less than hands-on knowledge and hypothesis testing. And today there is no excuses not to practice. There is so many cheap, accessible tools which hypotheses can be tested, and they must be tested. With AI agents, we can now model entire system, environment, agents, behavior, including game theoretic scenarios before touching real services or real patients. The cost of experiments never been lower today, and not experimenting is the expensive option. Also, the critical factor of success is speed of implementation innovations. The time is critical now. The Institute of Digital Leaders, for example, in Ukraine, is developing at rapid pace. It's raising a new generation of professionals who are capable to driving change, taking responsibility, and setting incredible peace in work. One more thing. AI itself evolving so fast that even skills we consider essentially today might disappear. Prompt engineering may vanish as a skill because access becomes effortless. What replaces it? Deeply human. Creativity and the judgment to evaluate and select right ideas. Though those are the skills that we invest in because they don't depreciate.
Thank you. Let me turn it over to Mariam, you now, and ask this question: that how is Morocco preparing its health workforce, clinicians, as well as healthcare managers and non-clinical staff to work effectively with AI-enabled solutions? Can you provide some examples?
Yes. So first of all, I want to thank the WHO for bringing us together here in this beautiful city, and also for organizing such inspiring workshop and conference. I am very glad and pleased to meet you all and to learn from each one of you through the presentations and also from the conversations we had in the breaks. So thank you all. So back to the question, for Morocco, we launched Digital Morocco 2030 strategy, and health was named as a priority sector within that strategy. And also, we recently built an organism that's called Jazari Institute. It's like a national network of centers of excellence for AI, connecting universities, government, startups, and industry across country, all the country. And health is one of the sectors of that this network is meant to serve. So alongside of the other sectors, of course, and we also work on strengthening our infrastructure. And to do that, we first need to unify our hospital information systems. and move toward a single electronic patient record. So right now, our data is still scattered across different systems, and that makes it genuinely hard to do the kind of advanced analytics, decision support, and of course AI prediction. So that's we are aiming for, and that's what we are working on. So that's a unified digital foundation for us. It's a prerequisite, and everything else it depends on it. Also, we are very aware that preparing the workforce for AI is the most important investment, especially in a sector as sensitive as health. So when it comes to preparing the health workforce, it comes down to 3 things for us. First, it's awareness and trust. We started with awareness campaigns for AI in health through organizing AI conferences, meeting, and workshops to explain what the AI is and what it isn't. Also, we run continuous training for AI tools. We have and we built real feedback loops. So we update and adjust the AI tools based on practitioners' feedback. The second point is curriculum and research, as Dr. Ali said. So we integrated digital solutions into the training of doctors and nurses, and now we are looking at going further than that and bringing AI directly into the curriculum of doctors and nurses also. And we encourage our ministry staff to keep studying, especially pursuing their PhDs in AI. And that's through partnerships with the university, and we started with the Mohammed V University of Rabat. Also, we are working on new AI talents. We are created specialized schools and institutes for AI engineers. And the third point, and I think it's the most important point, it's change management. And we are realistic about that. It's more than anything else, it's important more than anything else. Change in health is never easy, especially for senior practitioners. Technology alone doesn't change habits, no matter how good is it. So we are deploying with real change management, continuous support, and a real focus on accessibility. Because if a tool isn't easy to use in a busy hospital or health center, at the end of a long shift, it's just won't get used. So that's what we are working now on. And if I want to sum up our approach in one line, build the adaptable foundation, train the people at every level, and support them through the change. The technology, honestly, is the easy part. We have many tools now of AI. But we need people aware of AI. We need a regulation for that. And thank you.
Thank you, Miriam. So let me move to the second aspect of this conversation, which is institutional capacity, the structures we need, and the partnerships that we need. I'd ask each of you a question here. Maybe keep your responses a little bit short so we can get on to the third aspect, which I think is also very important. First, let me ask you, Ivan, there was a recent AI readiness assessment that was conducted in collaboration with the Pan American Health Organization that identified several key areas for Costa Rica's digital transformation and, of course, identified a few opportunities as well. Can you tell us a little bit about it and then how you are looking at it in terms of healthcare workforce transformation?
Yeah, absolutely. In Costa Rica, the cross-sector collaboration is not only happening, it is essential. PAHO, for example, with my college learner, Mirna, contribute to confirming something very important things. Costa Rica already have a strong foundation. We have a long history of digital health. We have a valuable health information system, but in silos. This is a big problem for using AI. We have a national digital strategy. We have 2 ministers who work in AI, for example, Ministry of Science and Technology and Ministry of Health. However, the assessment is so highlights several important challenges. The big challenges is not technology. The technology exists. Maybe you can adopt one model, and in 1 month, this is another more powerful, more easy to use. The biggest challenge is the change management. How you maintain this thing in the personal, in the people, in the patient, the continuous challenge. The real change is how manage our data, how trust in the AI. Data flows often stored in different systems, using different standards, different levels of quality, and this is all order of challenge we have. Before AI can generate value, data must become interoperable, reliable, secure, and ethical governed. Another important opportunity is the people. AI is not only about the software engineers. I say that another days. The people think the AI is IT technology only. I know we need a multi-capacity, maybe. Capacity in hardware, capacity in person, in professionals, in cybersecurity, patients. And another challenge is which AI application represents higher risk. What data can I use? How do we ensure the transparency? How we prevent bias? How do we protect the privacy? Still encourage innovation. This is another challenge we have. One of the greatest opportunities for Costa Rica is avoiding duplicated efforts. If every institution develops AI independently, we waste resources and create incompatible solutions. And we have this problem. We have many providers who try to test models, but in different institutions, and waste time. You need maybe modify your systems in different institutions, and this is a waste of resources. Ultimately, our vision that AI should be helped you to move from reactive healthcare to prevent and predictive healthcare. AI should support better public health, improve the traceability, optimize resources, and provide better evidence for making decisions. So far, for my country, the priority is not simply deploying AI. The priority is building the right ecosystem where AI can be trusted, scaled, and sustained over the time, not for the pilot.
Okay. One theme you identified that I wanted to probe a little bit more was duplication.
Yes.
So right now, of course, there are a lot of ministries that directly are impacted by AI and need to work with AI. Ministry of Education, Ministry of Health,
Yes,
Ministry of Science and Technology. So do you have any pointers of how coordination happens across those ministries? Is there an example of something that could be helpful for our audience here?
Yeah. In this case, the Ministry of Science and Technology is the arm to organize all the ecosystems in the government. The Ministry of Science and Technology try to union to health, for example, Ministry of Health and Social Security, and the private sector to exchange, for example, in interoperability archives. In Costa Rica, we try to change the model when the data is for who receives, or who saves data, and not for the patient.
Okay.
This change is so important and so difficult to understand for our people because you travel with your data in private, public, and social sector. This is the highest challenge in this moment we have.
Okay, great. Thank you, Ivan. Let me move on to you, Michael. How do you align investments and procurement at both national and provincial level? Again, this question of coordination and not having a lot of duplication to avoid fragmentation before AI can be introduced safely and sustainably. So how do you coordinate at various levels?
Yeah, so thank you for that question. So for Papua New Guinea, we have a robust governance framework and mechanisms that are vital for the coordination at the national and provincial levels. We believe that these digital health governance structures must consist of functional committees that oversee digital health across the national and subnational levels, and also a structure for partner coordination. It is important that the roles and reporting pathways for these structures are clear and are led by the national level. Thank you.
Sure. Thank you, Michael, for that. My next question is, again, Ivan, I'm going to ask you that question. Considering that Costa Rica has already taken steps towards building a sustainable AI ecosystem, could you please share examples of how you have managed AI projects across different government sectors? I think this builds on the last question I had for you. In the same way, have you learned anything from these experiments that you have done to create this coordination that you could share with us?
Yeah, of course. For experience, for example, we understand the AI is not a thing only for technology. It's for managed change. It's necessary to change the governing, how we make the things, change your workflows, not only in healthcare, in everything. That change all. Our success has been understanding that artificial intelligence should be begin with the governance, not with technologies. It's very important to start with impressive AI tools project. Yes, of course. But it spends or it makes a silos in different institutions, what you say. For example, we have an Institute of Social Security to give a different health in different sectors. And we have a master patient index, for example, in Social Security. We have a master patient index in the Education Ministry of Education, and have the same data. And we have, we try to unify this data lake for AI use. This is, for example, one challenge we have in the country. Other example is the promotion of multi-sector collaboration. Ministry of Health not alone can deploy AI solution. Need other sectors, private and public. Ministry of Health, Ministry of Science and Technology. For example, yesterday we have a meeting with Google. Google tried to help you, but you need have a solution integrated for all ecosystem of government, all ecosystem of private, because the patient, for example, in health, is traveled around these sectors. Other important is the cybersecurity. Costa Rica have in the past problems with cybersecurity. We have attached big hackers in the social security. We have 2 or 3 months, for example, challenges to liberate information in health system. And cybersecurity is so important for the government in this moment. Ethics and workforce is necessary. Try to say or try to change the mindset for all the workers who work with AI. AI is a tool, not your replace. It's so necessary, for example, include the patient. The patient needs to understand AI can help save her life. Maybe it's important say what is the benefit to use AI in clinical act, for example. I see in the last presentation, it's necessary to say, maybe I can record your voice. It's okay. He say no. Okay, maybe I can spend my time typing. I'm not watching you. I'm not sharing you. I'm not listening you. It's necessary the patient understand that. The benefit of what use AI. Maybe that's have my examples in this case.
Yeah. I think one of the other aspects, building up on what you're saying, is that when we look at workforce development here, I think we should, listening to our speakers earlier, the development or the education should not be restricted to healthcare professionals only. I think it's a wider conversation of making sure that the general population is also receiving that awareness and education related to AI. Otherwise, it will not solve the problem if we just focus on the workforce, building up on what you just said. So let me turn over to Ihor right now. Ihor, what can other countries learn from Ukraine in order to build resilient and innovative health systems, particularly with regards to AI? What are some things that we can learn?
Today, I think our system tested every day. So Ukraine's health sector faces dozens cyber attacks daily. Just recently, a major attack took down several systems in our health domain, and I will not name which ones for security reasons, but all affects services have already been restored. And literally yesterday, while we sitting at this place at the conference, another cyber attack hit our organization, and it was repealed, and detailed incident audit now is underway. So the threats are not only digital in our country, it's physical. During recent massive missile strikes, when ballistic missiles can't always be intercepted because of lack of storage of air defense interceptors, a country's largest data center was hit. Restoration is already well underway, but this is really no textbooks in digital health prepares for you. And it's why continued air defense support from our partners directly protects health infrastructure and patients' data. So what we can share with our partners? I think the first of all is institutional clarity. Ukraine runs a single national health backbone with a clear definition of roles. Everyone knows what to do. The unbreakable management vertical I previously mentioned work precisely because everyone knows their role before the crisis, not during it. The second one, a crisis accelerates transformation, but only if you change now how you're making these decisions. So under pressure, we shortened our decision chains, cut procedures that didn't give added value. And for now, we run processes in parallel instead, making step-by-step waterfall. It's also an AT example. So third one, and maybe the most transferable lessons, ruthless prioritization and resource management. It's the most important one because our resources, money, people, energy, time are always limited, especially in our wartime. And every initiative is tested against one single criterion. Does it deliver value for the patient or for the system? And if it's not, we don't need such transformation. And innovation under limits means using everything in the can. Cheap and accessible tools, open source solutions, partner platforms, whatever works. So innovation, it's not a function of big budget. It's a function of a clear goal. Our goal is a patient and everything else is negotiable. And last lesson regarding AI. Prepare and gather your information and data. That is first. That's a basic and fundamental. And the second one, which is not the least important, train your teams to work. Even with Claude, even with ChatGPT, even with other instruments, they need how to work with AI. They can't only speak about that. They need to check it. They need to work with some home or work tasks here, there. So that will help like a basic stuff. And share the knowledge and start something and it's going to evolve even without you.
Thank you. Thank you for that very comprehensive answer, Ihor. Michael, let me turn back to you again. A lot of times when we look at these capacity building initiatives as well as technological solutions, a lot of that is sometimes dependent on partner support. So I wanted to hear your thoughts on what would be most useful for Papua New Guinea in terms of these solutions? What partner support would be needed so these solutions can be implemented at scale and they do not remain pilots that we were talking about earlier?
Thank you. I think the ability to implement strategies is a challenge for LMICs like Papua New Guinea. Local technical capacity and expertise in digital health as well as AI is as much of a challenge as funding for digital health. PNG, I would say, needs support in several key areas, supporting the development of foundations such as the necessary components for health information exchange, support in the capacity building of health workers in digital health literacy and AI use. And this also applies to training for the technical workforce or staff that will provide support to this health workforce. We also, for Papua New Guinea, we think that technical support is also needed from partners to develop a minimum set of preconditions relative to Papua New Guinea's context. That will also include criteria to guide the assessment of AI tools for responsible and safe adoption. Because Papua New Guinea, we don't have an AI strategy currently. Thank you.
Sure. Thank you, Michael. Ivan, my next question is directed to you. Looking ahead as we consider sustainability over the next decade when it comes to AI, what foundational steps does Costa Rica need to take to ensure that there's sustainable AI, but also that AI is equitable? What are your thoughts?
Well, for equitable, we try to generate the human capacity in the academia, for example. Well, Costa Rica have a different population, maybe not in the Central Valley. We have principal cities, principal hospitals. No, it's so far to the central area. To maintain the capital human in these large places is difficult because we don't have connectivity, maybe we don't have the hardware or the professional can travel to these places. This is maybe the principal challenge we have like a society. But we have secured that, for example, in the past, the tire was that tool, the harm of rock is a tool, but in this moment, the AI is the more powerful tool we have to change the life for all the people, for all the country, not only for the citizens of the Central Valley, around the country. Maybe this is a response for that.
I see. Yeah, no, I mean, look, we always risk with AI that if we don't use it very responsibly, then we can just propagate inequities at scale,
yes,
just
sir.
because of how AI works. So that's a very important conversation, I think, for each country as we look at equity when it comes to AI.
Yes,
there's, of course, a global equity question, but also within every country, there's a question of how do you create regional equity and equity for various socio-demographic groups that are going to be using AI. So thank you for that response.
Thank you.
The third aspect of it, Miriam, I wanted to turn to you and ask you about is that as AI adoption expands, how should governments address the environmental and sustainability aspects, or rather the implications of digital infrastructure? We talk about the computing power, energy use. So how should governments and institutions look at it? What are your thoughts?
Thank you for the question. So when we are talking about AI, we are talking about huge data centers. So we are talking about energy. For us in Morocco, this really starts with our broader energy transition. Not health specifically, but all of them, all sectors. Morocco has committed to reaching 52% of renewable energy by 2030. And that's shaping how we think about the computer power AI and health we'll eventually need. We are already building a renewable power data center, including a 500 megawatts project in Dakhla that will run entirely on solar and wind, and pushing toward green data centers with much better energy efficiency. But I don't want to just talk about our ambitions. There is a real tension here. Data centers use a lot of water, for cooling, of course, and Morocco is already dealing with the serious problem of water. So for us, green can't just mean renewable electricity. It has to mean water-cautious cooling from day one, or we end up solving a problem by creating another one. That's generally something we are still figuring out, and it's exactly the kind of thing where we hope WHO to work with us on, and help us to find a solution for it. So our view is simple: playing for the computer footprint, and that at the same time as the clinical rollout, not after. So thank you.
Thank you, Miriam. This is an important question in terms of sustainability, energy use, computing power, infrastructure. So perhaps maybe I can have Ihor, you respond to that as well. What are your thoughts? What is Ukraine doing in this space that other countries can learn?
For sure, in our country, I think sustainability is resilience is defining feature of our system, and it's constant hard work, flexibility, and unbreakable management. I think in IT domain, if we talking about resilience and sustainability, we means it by design. So cloud infrastructure, layered security measures, including a clustered architecture. We use Starlink terminals as a backup for fiber optic connectivity. We use generators replacing centralized power supply, and many other measures. So every critical function has a fallback, because we know that the primary channel can disappear in any moment. We also used some European servers when our service was hit and when full-scale invention was started. So partner support is also one type of backup, and thank you all the partners for that.
So with that, we'll bring this session to close. I wanted to thank our audience, our speakers, our panelists for very, very interesting discussion. I think what we learned from this session was that when we look at AI in health, I think the two most important stakeholders are clinicians, and I use the word clinician because that's a broad term that includes all cadres of healthcare professionals, as well as patients and communities. I think those two we need to be mindful of and keep them in the center. A lot of, you would have noticed from the two presentations we had that there are a lot of overlaps in terms of both the benefits and the concerns of AI that were raised by clinicians and patients. But then there are some divergent themes as well that we need to be mindful of. And then when we talk to various countries, we notice that various countries are in different stages of AI adoption. But a clear theme there is that we need to work on our workforce. So workforce capacity development is an important aspect that we all heard. The second, I think, concept that we heard was coordination remains important. And that is going to be important at the healthcare system level, at the level of various ministries, at the level of various countries, and as we work with partner agencies as well. And then the last thing that we talked about was sustainability, the infrastructure needs, the energy needs. So countries that are in the earlier phases should already start thinking about these issues as well. So, this brings us to the close of this session, and if I have to use an analogy when it comes to AI and as countries and communities look at it, There's a one-liner that goes very far. It says that you've got the key to success. You've got the key to success if you've learned the difference between movement and moving in the right direction, right? So with AI, right now, quite a few things that we may be doing might be giving us that lateral movement, but if we really have to leverage AI to improve the quality of life of people that we serve, not just in the health sector, but in any sector, we'll have to make sure that we are moving in the right direction. And I do believe that these discussions and conversations will allow us to identify those issues that will allow us to make that right movement in the right direction, not sideways movement. With that, I thank you all for your time, and we'll keep the conversations going. Thank you.
Thank you so much.
Thank you very much, Salim Virani, for facilitating these important conversations. And thank you to everyone for your valuable contributions. It is now time for a coffee break. Kindly return to this room at 11:30 so we can start with the next session on global coordination and investment. Please take your seats. We are going to start. Thank you. Welcome back. I hope you had a nice coffee break. It is now my pleasure to welcome to the stage Andy Moose, who will share his views on why global coordination matters for AI in health. Andy Moose is Head of Health Systems Transformation at the World Economic Forum Center for Health and Healthcare. Mr. Andy Moose, you have the word.
Very much, and thank you for the opportunity to welcome you back from the coffee break on this second day. I want to take this opportunity to thank the WHO and the Government of Portugal for this very thoughtful set of discussions and convenings that they've set up over the 2 days. And I'm very pleased to be here on behalf of the World Economic Forum, the Center for Health and Healthcare, and where we anchor our work in shaping the future of AI and health in the Digital Transformation Initiative. And so I want to talk a little bit about the focal point here is really on global coordination. Why is this important? How does this affect the way that we move forward, but also looking at the ways that we avoid fragmentation that can occur that dilutes those efforts, and also really to look at ultimately how does this drive decision makers that are implementing this on a day-to-day basis. We know that we don't lack AI pilots and discoveries. Many have talked about that. We're going through those phases. We don't lack principles or excitement or enthusiasm about the potential for AI in health. I would say that what we still lack is sufficient evidence. We still lack coordination capacity to really improve and really realize the promise of these tools. And so the right framing really is not so much about AI adoption for the sake of the technology itself in health, but really how do we construct intelligent health at scale and really take this opportunity not to simply implement these technologies, but really understand their capabilities to drive health system transformation that's enabled by AI and other emerging technologies and health data. My argument is simple. If we invest in AI, one institution, one country, one data set, one rule book at a time, we will indeed end up scaling much of that fragmentation. However, if we can coordinate around shared learnings, shared foundations, shared assurance, investment, we can better limit that fragmentation and ultimately scale the impact that we want to see for individuals, for clinicians, for governments, and also ultimately for the economy and society. And so, as we've talked about earlier, this conference has been thoughtfully constructed. Yesterday, really talking about the leadership that needs to be mobilized in terms of readiness, the important and critical role of regulation to set the guardrails and framing for advancement, and ultimately the leadership that's needed to really guide responsible scaling of AI in health. Today, we're talking more about implementation itself, workforce readiness, institutional capacity, investments in scale, and really where we want to focus in terms of avoiding fragmentation and ultimately coming together on some level to really maximize the potential of these tools. When we think about how fragmentation appears at the forum and where do we see that happening, we see it happening really across 5 different layers. The first is really just looking at the basic foundational layer of data, digital infrastructure, where you still see relatively low interoperability, incompatible systems that are also often managing across very fragmented or siloed data sets, which many of our speakers have earlier pointed out. We're also looking at the layer of governance and regulation and the opportunity to really drive more cohesion in terms of the safety, evidence, privacy, and liability expectations, which allow organizations and entities to be able to work not just within systems tailored for a single country, but ultimately be able to deploy and adapt those systems across geographies as needed. We also look at the layer of procurement, payment, and investment. Where does that architecture and governance and guidance come together in terms of actually deploying these technologies to move past those pilots and really provide the reimbursement pathways that are needed to guide responsible deployment of AI in health. We're also looking at readiness in terms of workforce institutions. As many have pointed out, we see a lot of uneven AI literacy across those different groups. Ultimately, we feel that the real tipping point here will come when the fidelity and impact of these solutions is richer and really people understand intuitively the benefits of these tools because it's deeply embedded in the workflows, it's deeply intuitive for patients to engage with, and the AI may not be as seen or as present, but more in the background doing its job to create just simply an overall better experience. We also look in terms of the layer of equity and trust, which we've talked about. That's really the responsible piece of the advancement of AI in health and really making sure that models have the flexibility to tailor to local populations, language, and not just individual needs, but also the values, of the cultures in which they're being deployed. We also see this turning the potential of fragmentation to turn the high level of innovation that's happening today into systemic costs. Ricardo yesterday from Health AI pointed out that evolution and the evolution of cost of healthcare, from 1920 to today as being a significant increase with not the same commensurate jumps in terms of improvements in health outcomes. So we see those costs coming in a couple of forms. It's not just duplication. It really comes down to delays and really potential inequities as well as the need to avoid harm. We are seeing increases in potential costs and slowdowns in validation where there's parallel infrastructure or duplication across a number of areas, and also seeing the fact that trust and competitiveness can be weakened by some of those same elements, where you have uneven standards or organizations feel that they're not able perhaps to even enter into a market because the conditions are too cumbersome or they feel that they won't be able to do those in a reasonable amount of time. And that ultimately locks in inequity, where only the largest markets or the most robust ones are able to receive the latest innovations in a timely manner. And that often leads to misses in terms of meeting local needs and the ability to drive those benefits as being undervalued. And so a lot of this fragmentation really does mean that being able to drive that productivity as a key lever will be critical, and really the need to look at how the potential of this can really be overcome through more of a focused effort on coordination. And so to that end, we really feel like there are a few different moves that we can all make together that really will help increase the efforts of that coordination. There are so many valuable networks that are out there today driving and shaping the future of AI in health. But we really want to make sure that each one is not creating its own framework, its own vocabularies, its own tools for us to navigate. And so really aligning on those common foundations across those disparate networks is critical to really make sure we can create the interoperability, the shared digital public infrastructure terminology, and start to converge on some of the key architectural and foundation evidence that's driving that future. We also want to look at how do we build more reliable and shared assurance models, and also the ability to drive and increase capacity to actually adopt, effectively implement, and administer these technologies. So that's going to mean more common templates in terms of evidence gathering, regulatory reliance, local validation, and real-world monitoring to be able to actually drive the workflow reimagination that we want to see in the transformation, and not simply the adoption into existing pathways that may or may not take advantage of the full capability of these tools. We also want to mobilize and look at the role that we at the forum and other platforms like ours can provide in terms of mobilizing really value-based investment coalitions. We have a lot of partners that come to us that are very willing to share data or other things that can inform policy or the advancement of collective action in terms of things like improving rural health access or reducing the burden of chronic disease. And so as we look at, well, what role are we playing at the World Economic Forum, we're really focused on how do we drive intelligent health at scale, specifically through the lever of public-private collaboration. And so we really do that through our digital health transformation initiative, where we're focused on really three key elements. One, we're looking at what are the insights that matter most for the ability for the public and private sector in a very fast and dynamic space able to come together in an efficient, effective way. We know that everyone's extremely busy, and so being able to take a lot of the concepts and complexity that exists out there in advancing AI and health, that's a challenge to figure out how to do that. So we try to leverage insights in terms of where is it, for example, we just released a report looking at the horizons of the future of the life sciences and medtech industries. They're going through very dynamic transformation as they look to incorporate AI. The patient-provider relationship is changing. They're repositioning where they're creating value, which just in terms of their own business strategies creates a lot of complexity. They're operating in an environment where all the while they're also trying to navigate price pressures and trying to understand what is the public sector vision for the evolution of their industry in different parts of the world. And so that's just an example, but we leverage those insights. We also look for what we're calling pathfinders, which are where are those enablers, where are those examples or exemplars, I should say, where there are parts of the world that are effectively scaling and driving forward the advancements and realizing that full potential. Many of our organizations and partners want to understand at a deeper level, how is it that they're able to achieve that? How did they position the investment? What is exactly that's doing? And so that's where we've created a way to lift up your examples and the works that you're making every day through our Pathfinder network to inspire and inform and provide insights to others around the world. Ultimately, those Pathfinders, the exemplars, combined with some of the guiding insights about the role of public-private collaboration, comes together in something where we're looking at in terms of ecosystem shaping. How can we create a space for global leaders to really take a step back and look at, well, what are the barriers? What are those enablers to overcome those? Are we approaching this as effectively as we can? And what are those specific pathways? And so we're working specifically within the US and North America, and also looking for opportunities to increasingly engage the European Commission with Marco and others to really figure out how can we bring our partners and our connections in the private sector to bear in a more effective and efficient way to contribute. So that's just some of the work that we're doing, and I think the whole point here is to really look and synthesize the collective signals that we're all seeing. How do we not react to noise, but really connect these networks that are already very actively moving? I've got just a few examples here in terms of the WHO's role in really creating that global guidance, country readiness, equity. I mean, we've heard today and yesterday a lot of those examples that are extremely helpful to understand how is this really happening on the ground and where is there struggles models that are continuing to come up in different markets with different resource models. We also want to promote things like the OECD's work around the Madrid Action Plan, Health AI. We had Ricardo yesterday talking about the critical role they're playing in bringing together global regulatory networks. The bottom line is we have a number of different regional platforms and also global platforms, and the real key to avoiding that fragmentation is to figure out how can we continue through convenings like this, meet on an occasional basis to maintain that cohesion, to really drive the impact at a systemic level that we all want to see. And so ultimately, this is about trusted and responsible value at scale. And it's really about how can we come together to establish that trust architecture, continue to drive and really advocate for advancement, keeping health and digital health high on the global agenda when those priorities are always in competition with geopolitics, trade, and other challenges. How do we ultimately get the investments that we need for the implementation capacity, not just for the individuals, but even for the architectures themselves? How do we consistently lay those foundations? And ultimately, how do we prove this is working? How do we come up with that evidence base that lays out what are those methods and the areas of focus? It's one of the challenges with digital health is how do you lay that foundational architecture while also maintaining enough of those quick wins to sustain the investment and sustain the commitment. So all that being said, we just want to offer our platform at the World Economic Forum to continue to support these conversations, to bring the public and private sectors much more closely together. And with that, I would just like to say thank you and obrigado.
Thank you very much, Andy Moose. AI in health is not a topic one country alone can solve. Creating robust and resilient infrastructures and collaborative ecosystems are key factors to success. Therefore, coordinated efforts in AI investments will be crucial for implementing AI in health globally. It is thus my pleasure to announce the next plenary on AI investment perspectives and welcome to the stage Melanie Bertram, Head for the Delivery for Impact Unit, WHO headquarters, who will moderate this session. Melanie Bertram, the stage is yours.
Thank you very much, and it's really a pleasure to be here. So just a small correction, I'm not the head of the Delivery for Impact Unit. We did a restructure at WHO last year, and I'm now the head for the unit on Insight, Capacity and Operations in the Department of Data, Digital Health, Analytics and Artificial Intelligence at WHO headquarters. So my team is really working on the assessment of capacities at the country level to translate global norms and standards into what happens on the ground, and building on that, correcting those missing capacities and linking to finance. I spent 10, 15 years prior to joining this department working as a health economist at WHO, developing return on investment studies, investment plans, working with banks to bridge technical work and finance. And so this is like the bringing together of both of my professional worlds into a single panel on how do we align investment perspectives for artificial intelligence. So I'm very delighted to be here and looking forward to a really exciting and stimulating discussion. We're going to start with my colleague Ana Luisa Neves, who is going to present to us on a proposed framework from the European WHO Office on AI investment. Ana Luisa is a clinical associate professor in digital health and director of the Global Digital Health Unit at Imperial College London. So Ana Luisa, if you would come forward, please, and share with us your presentation. Thank you.
Thank you, Melanie. Bom dia. Good morning, everyone. It's a huge pleasure to be here, and thank you for the invite. And of course, I'm looking forward to a fruitful discussion. And I'll start to share a little bit of the background about investment in AI and why that matters. So we won't be surprised by knowing that AI is changing how governments and countries position themselves nowadays. And this is not just about healthcare. It's really about countries and governments seeing AI and how they develop their AI strategy as a national capability and a strategic capability. So what we have been seeing the last years is the struggle that as a global community we go through trying to make sensible decisions about how we use our limited resources and how we channel them into the solutions that are able to deliver the best value for the populations and for those that we're trying to serve. So this is the background context. And no one here is going to be surprised by me reiterating that healthcare has become a priority on how countries invest their resources and their allocations to transform healthcare. So the first thing that I wanted to highlight here is the challenge. And as much excited as we might be by technology and by the hype and by the sexiness of the term, of the concept of AI, there's a real need to move from this high-level concept into understanding which specific AI solutions actually add value for which patients and in which conditions. And that's part of the rationale that I'm going to go back through my presentation. So I would start by getting us together back to the basics. Why are we investing in healthcare? Why are governments so excited about it at the moment? If we think about the major problems, and they have been reiterated here throughout the presentations, workforce shortages, complex systems, increasingly complex patients, and alongside that, an increasingly demanding society asking for higher quality, more participative, more engaged care. So we are getting this tension in which we actually don't fill the gap between the increased need and the not so increasing resources to support it. There's an opportunity there, of course. And the main reasons why, and these are data from the recent WHO report from last year, the main reasons why countries are actually pushing the AI agenda in healthcare are primarily because everything that we have discussed here today, we want to deliver better care, but also because we want to try to make the most of these very limited resources. And we have quite staggering numbers presented today here of more than 10 million global workforce shortages. So these are the main two goals that we have in mind. So these are the really two key contemporary challenges that we need to address. How are we using AI? And this is a bit of a landscape picture on how countries are investing in AI. We know that a majority of countries in the European region are already deploying AI for diagnostics. But we also know that this goes through a range of solutions with different levels of maturity, capabilities, safety, and therefore a range of trust perceptions across them by the population. And I just wanted to park us here because this is relevant for investment when we ask what is the evidence behind it, how safe it is, really key factors to guide investment. We know that this is not the same for all technologies. So I could make some general claims here about how safe is AI, how evidence-based is AI, but fundamentally that will depend on the type of technology that we have in that list. A digital scribe, a predictive model, a large language model as a chatbot, they will have completely different levels of safety, completely different levels of evidence backing them up, and they will have very different safeguards and railguards. So as much as I will try to remain high level, and those working with me know that I have a bit of a slight hate with the word AI, because I think as much as helpful it is to get us together and to have a common shared discussion, it's also a little bit of a trap, because it might help us to get in very high-level conversations and prevent us to move into the detail. So, apologies me for the ranting, but I think that's important context for what I'm saying next. Another problem is that, and this has been flagged here, adoption is outpacing governance. We have seen this in a range of examples. I'll share with you a very short story. Digital scribes in the United Kingdom and in many other countries, they just flew before regulation was able to have a say about it. Doctors were using it. Today, Eva shared that consent is still a little bit uneven as well. People just hit the ground running. They adopted technology, and regulation was still trying to decide if scribes were a medical device or not and how they position ourselves. So we are talking about making sensible decisions, strong decisions, evidence-based decisions in an environment which is moving at a pace that we cannot really keep up with. So I would say that we probably all agree that the challenge is not really about building AI. Is, as many people have reiterated over the last days, how do we make it a meaningful piece of the puzzle? How does it get embedded in processes? And most importantly, how do we pick up what things actually matter? Where do we invest? When do we invest? How we invest in a sensible way? And that's the reflection that I'd like to bring here. I don't need to reiterate how many billions have been invested in AI, different levels, different countries, and this comes also through different routes. And my key message here is really that although we have a variety of investment channels, and we have just covered some of them previously, national strategies, public-private partnerships, these will fundamentally depend on the context of the country itself. We do know that there's a huge variability. There's a huge variability on the definition of what's an AI priority, and different countries, as you'll see here, or different regions, in this case, WHO regions, will have different levels of maturity on identifying what matters as an AI priority. And you could argue that is really the first step. We need to agree on what matters, right, before we actually decide how to invest on that. And you'll see that's not always the case based on this plot. And then we have different levels of maturity once you identify the priorities on how you invest it. This is fundamentally shaped by the context of the country. Again, this is nothing new. You will know this from your own countries. Whether you have a strong political public commitment with advantages and disadvantages that come with that, sometimes slower, sometimes a little bit more rigid processes, but often with a longer-term vision, or you can have more fluid, more agile, more responsive systems that will also encourage probably a range of solutions to contrast and compare with each other in a more liberal way. So this context will shape fundamentally how we want to invest. And my key message here is, and I'm sorry because I'm not going to give a black and white answer. The answer is it depends. We can create a framework that help us mapping the key principles, the core values that we need to consider. But the way in which we'll actually implement it and tailor it is local. So that always reminds me a very old mantra. So before I became an academic, I was a general practitioner, and I had the chance to work in low and middle income countries as a volunteer doctor. And I think that's something that definitely shaped my way of seeing the world. And I remember someone telling me this, I was 20 years old, learn global, act local. And this sentence keeps coming back to my mind, whether it's policy with implementation, sorry, I've been fighting with technology, whether it's academia, whether it's industry, whether it's implementation, whether it's investment, we need to learn global lessons, but these lessons will have a relative impact when we get to the ground. The ground knows the needs, the ground knows the resources, and the ground usually should be able to balance those and to contrast these tensions in the best way possible. So, final point on why this is complicated. The evidence base is relatively thin. And as an academic, I often struggle with these completely different paces that we have in academia, which we are trying to change. And there's a lot of governmental push to dive different, to be more responsive, to be more focused into rapid evaluations. But it takes time to get evidence that we feel comfortable with. And that time is time that we cannot allow. We cannot afford that time, because technology is getting to the ground, is getting adopted, and we are flying as we go and hoping that quality and safety are still preserved. So, oh, sorry, there's something. Oh, sorry, I'm using the wrong one. So, what are the main consequences of not getting this right, of not having a clear pathway to investment? Decisions are inconsistent, and we all know what does that mean for equity and equality, both globally, nationally, and even regionally. We waste resources, we waste human resources, financial resources, we duplicate our efforts, we end up with a range of different tools that will be somehow comparable and will have some sort of overlap, but do not necessarily clarify what we really need to do in practical terms. And there's very little clarity on which solutions actually deliver value and how we prioritize them. So, that is really the value of having an AI for investment framework, is to get some kind of logical principle and steps that guide us through the process. And what we tried to do here was to understand that the value of this priority, or the main outputs that we want of this framework, is really to help us to prioritize what are the needs of the system. And I couldn't reiterate it as much. Solution might be the problem, yes or no, but before that we must ask ourselves, what is the real problem that I'm trying to sort out? What is the problem in my country or in my region? Is it access? Is it timeliness? Is it safety? Is it lack of primary care support or universal health coverage? So the problem should be always the key principle. And then technology might be an answer if it is great. If it's not, by any means, we should take the route that gets us to the right solution. So prioritize what is the problem. Make sure that we are reducing the risk of our decisions. If we invest in a certain technology, there will be risks associated, cybersecurity, data security, algorithmic bias, increasing the digital divide, entrenching inequities, so many others. If we can preempt this from the very beginning and use this to guide our decisions, we'll be reducing not only our operational risk and institutional risk, but most importantly, the risk for patients. And then how we navigate the different steps. How we build from the problem that we have, the prioritization of the problem, to understanding the local context. How ready is my country to do this? What type of infrastructure, of resources do I have? In which context can I play around? And use that context to inform the choice of the technology that eventually might matter. And lastly, the role of evaluation. Evaluation needs as much as possible to embed it there in the process, before the choice, during the choice, and ideally after the choice. And again, I think there's a lesson to be learned here for all of us as independent and interplaying partners on how evaluation processes and deployment and implementation can try to find a middle ground that works for everyone. So I'll finalize by sharing with you a proposal, and we had a chance to present this as a workshop before the conference, and this work was developed with the WHO Europe region with my colleague Ahmed Al-Baksmati, who's sitting in the third row. And this is something that we try to do to bring together different resources and to create this pipeline, this rationale of how to invest in AI, for AI in healthcare. And what we're really trying to do here is to get this decision point right. How do we actually realize the opportunity, realize the risks, and, oh gosh, sorry, I promise I'll behave with my hands. I talk too much with my hands. How do we balance the opportunity and the risk? How do we reconcile these tensions and make sure that this decision point acknowledges those tensions and mitigates those tensions in the best way possible? And also that delivers something that fits locally. And there's no right or wrong way of doing this. And that's one that was part of discussion on our workshop. Because we try to come up with a tool that's practical, implementable, as a set of steps. And we cannot expect that each country scores as the best student in the world for each step. And that's fine. We are not expecting anyone to perform optimally from a digital maturity, digital readiness, infrastructure perspective. We'll be in different stages, but that doesn't mean that not everyone has a path to follow and a path to improvement in a way. So what we did here was to create a logic framework which includes two different steps, and this first part is the development of the strategy, it's step one, and is really giving guidance on the key steps to follow. First, understanding the purpose, the scope, the governance. What are the boundaries in which we operate? And from there moves into understanding who you are. How is your country? How's access? How's readiness? How's digital maturity? And once you know your country, your priorities, identifying what is the problem that you need to solve, and understanding what solutions, mapping the solutions that are already at the feasibility, within the acceptable feasibility range, and pick up the solution based on the problem. And from there, designing the investment pathway and roadmap, understanding how we are going to deploy it, how we're going to evaluate and embed it, and ultimately validating and mobilizing. So as you can see for each step, and we'll be happy to share with you more details, is a prototype, is a draft that we are using as a starting point to share here. For each one of these steps, we are creating very simple worksheets, which are a very simple Excel document in which you can score yourself against certain parameters. And that will mean that from step 1 to 2 to 3 progressively, we'll have a summary of how ready is your country, what solutions did you find, how do they match the problems, and from there, in a very stepwise approach, guide countries through the process. So this is the first part, and once it is established, the second part is development of use cases. Once these are prioritized, build a pipeline, assess the candidates, and develop the specification. So as I said at the very beginning, this is not reinventing the wheel. This is trying to do the exercise of convening and mapping the wealth of resources that we have around and trying to find a common ground that's sensible, logical, and with which we all feel comfortable with, that can be then tailored locally. So I'll finish reiterating something that we have heard here often. So AI, yes, as a big box, as individual tools, might have the potential to transform healthcare. It will only work if it fits in the system in a way that's guided by purpose, evidence, and most importantly, keeping people at the center. Thank you so much for your time, and I'll finish now.
Thanks a lot, Ana Luisa, for the great presentation and grounding us in some frameworks before we move into what's going to be a really great discussion. So we've been hearing for the last 2 days what responsible AI in health will really require. So governance, systems, workforce capacity, public trust. But now we're going to talk about who is going to pay for it and through which channels that's going to happen. So there's going to be 4 people on the stage, and I'm going to invite them up one by one. So firstly, we have a regulator. So Marco Marcella from the European Commission, if I could invite you up. He's the Director for Digital, EU for Health and Health Systems Modernisation at the European Commission's Directorate General for Health and Food Safety. In this role, Mr. Marcella oversees the implementation of the European Health Data Space Regulation, the implementation of the Health Technology Assessment Regulation, and DG Santé's work on health system modernisation, as well as the EU for Health programme. Thank you for joining us. Secondly, we have a research funder. So Matthew Brown from the Wellcome Trust, the interim head of the Data for Science and Health Solutions team at Wellcome. His team set priorities and deliver a portfolio of investments in trustworthy digital tools, technologies and platforms to advance Wellcome's mission. Next up, we have a development bank. So Ali Habib from the World Bank. Ali is a senior digital health specialist at the Global Digital Health and AI team in the World Bank's Health Department. In this role, he provides technical assistance to World Bank country teams and clients in the planning, designing, budgeting and implementation of digital health and AI in World Bank financed projects. And then finally, we have WHO's own private sector funding arm, Anil Soni, the CEO of the WHO Foundation, a globally recognised leader with over 20 years of experience driving impactful public, private and non-profit initiatives. Anil's experience lies in leveraging market dynamics to enhance access to critical health technologies. So 4 different perspectives on the stage, and we're going to get to hear from them all about what really happens when the rubber meets the road and we want to bring funding, financing, investment to AI solutions. We're not expecting them all to agree with each other. They're coming from different perspectives, they have different ways in which they deploy funding. So please be honest with us. We can only do this together if we understand the different perspectives on the stage. So with that, let's dive right in. Where is the money actually going? So we're going to have a quick round of questions with each of the speakers to think about what's the actual landscape out there? Not what do we see in shiny brochures, not what do we think is happening, but what's actually happening in terms of where is the money going. AI investment can mean many things. It can mean research, product development, deployment, data infrastructure, governance, workforce, procurement, evaluation. It's very, very broad. And we know that the funding isn't spreading evenly across those areas. So let's start. European Commission, Marco. You're coming from a different angle. Standards, regulations, not direct funding. So we're curious, where does EU money actually flow? Does it go to research, infrastructure, regulatory capacity building? What could we expect from the European Commission?
So, thank you. Yes, I will bring the European Union's perspective into the matters, and for that, I think I need to clarify that investment is part of the jig flow. I don't see this distinct from capacity building and regulatory actions. So and by the way, as you were kindly reminding all of us, the problem of investing in it is multifaceted, because certainly It has a component that goes from, say, the European level, the national level, the regional level, the local level, as you say, which is very relevant for what we are doing, but is also multi-objectives and is certainly multi-stakeholders. So it is a complex problem per se. How do we, let's say, position investment in the way in which the European Union is working? Well, certainly, once you have the regulation that sets the rules, say, of the road, you would also need to create the infrastructures and that supports that systems, that the applications of that rules. So there is an important piece, a significant part of our work that is, for instance, when it comes to health, in enabling the digital infrastructure to transfer data between one country to another country. This is one little example. When it comes to, say, the capacity building, it is obvious that you need to intervene and support, say, the capacity in terms of data creation, in terms of algorithmic creations, and in terms of experimentation between data and algorithms. And this takes us into the realm, for instance, of gigafactories in Europe, or the capacities in terms of cloud computing and applications, of course, in healthcare. And the third, it is about the collaborations. I know that there were 2 or 3 remarks on the words pilots. Now, whether you like it or not, they are necessary. You asked me to be provocative. So the pilots are necessary because the pilots, they do, check where things work and where they don't work. And, I take the point that it's important to have a strategy for doing the scale up of projects, which certainly it may be considered to be one of the problems that we have to face, and certainly at European Union level we do recognize that problem, and we focus exactly on one of the elements that you were putting forward in your presentation, which is the total investment journey. But these pilots, they do reveal elements, and I close with this. It is multi-regionals, which means that you have to have the overall picture. It is not an exercise that you can do in isolation. This requires a network, exchanges, different experiences, political decisions, political discussions, to support the focused numbers of priority. But it is important that we do it together. So thank you again for the invitation to contribute.
Thanks, Marco. And yeah, we can't scale things that we don't know work, right? So that's where pilots come in. So Matthew, you fund research. So how does this sit with you? What's the balance between funding research and funding implementation and taking things to scale?
Yeah, thanks. So I think as Welcome, so our mission is to use science to solve some of the world's global health challenges. And we are primarily a research funder, and we fund quite a broad spectrum of that research. And so some of that is quite basic, and I think we've probably funded many of the pilots that have then failed and contributed to the pilotitis. So, in one sense, we have been very much part of that problem, along with other philanthropic donors. But I think there needs to be an increasing realization that how do you actually generate those pilots with a view, much like Annalisa presented, where you're getting a sense of what the eventual use case is and how you're setting up those early research studies for success, and then how are they being evaluated. And so I think too often research studies generate around sort of technical outputs and whether they've achieved a certain kind of set of metrics which don't necessarily align completely with the eventual use cases and the things that really matter in terms of health economics and other outcomes, which will really drive sort of scale up and roll out. And so Welcome, our role is one as a catalytic funder. It's not right for us to be engaged in funding kind of critical national infrastructure, but there is actually quite a wide spectrum of things that we can invest in and support. So there's that basic research element, but there are also kind of projects that we have enabled around regulatory approaches, using kind of transparent tools for monitoring and evaluation. We funded the MHRA in the UK to develop the world's first guidance for digital mental health tools to help try and close this gap between developers and high-level regulatory frameworks, thinking about AI airlocks and how you can bring developers in to be able to test their tools and products with the institutions that end up needing to roll them out. And so actually, there's quite a broad spectrum of where research can sit within this pipeline, and it doesn't stop with implementation. Actually, it should carry on. You need the ability to monitor and evaluate those tools in context, especially when you know those tools might be sensitive to drift, bias, other things, so you need that structured evaluation built in.
Great, thanks. Very interesting perspective. Anil, we're going to come to you, and it's quite a different angle on this because the WHO Foundation is raising private finance to fund WHO's priorities. So what are you seeing in terms of where people want to fund? Is it the tools themselves, the regulatory systems? Where are the gaps, and what's easier to raise money for at the moment?
It's a great question. I'm going to take a step back before answering it because I think the use of tools implies a way that we think of what AI is. And Luisa, you said earlier you don't necessarily like the term. And as I was listening to this morning, I wondered, when each of us says AI, what actually comes into your mind? I come from an HIV background, and so it's easy for me to think of AI as a shiny new object in parallel to a tool, a medicine, a vaccine, a discrete product. And when we do that, there becomes the natural contrast, given our bias, between product and delivery system. And there's always been a debate in health between buying the product versus buying the delivery system. But what I would offer is that AI is not a product, that it's a general capability. So it's actually more like electricity. And it's going to be dispersed and hidden in all digital technologies. And if you think about it as electricity, as a utility, then the funding orientation actually changes quite a bit. Because in order to have electricity, you need a grid. It's not optional. And if that's the case, then we can talk about the governance, the data infrastructure, the capability as essentials, not nice to haves. Because if what we're focused on is the tool, which is an application of a capability, it's very easy to keep our focus there. Whereas if we think about the capability as being dispersed through systems, then for the companies themselves, where I think, again, a lot of us are biased, right? These are big companies, surely they have a lot of money to fund this type of work, which I'll come to. But then it's market readiness, right? So, I get asked a lot of questions about conflict of interest. And here's where I would emphasize the importance of thinking about alignment of interest. Because those who are developing the capability want to make sure the systems exist to deploy that capability in whatever tool. And if that's the case, then maybe there's much more alignment on what we would otherwise call unglamorous as actually the necessary investments for those companies to scale their product, their capability. And then you can have an alignment between everything we're talking about at this meeting and what these companies absolutely need to have in place in terms of market readiness. And that's where I think we can see some synergy. Now that assumes we're talking about corporate philanthropy, which by the way is only 7% of all philanthropy, at least in the United States. It also, we should talk about where is the money coming from because ODA is declining, but maybe I'll wait for the next question for that.
Thanks. Interesting way of framing it, that AI is like electricity. And I think this is a good thing for us to keep in mind moving forward, that we're not necessarily talking about shiny tools, little tiny things, but what we're really talking about is whole of system change and how that gets financed. So Ali, on that note, from the World Bank's perspective, the way that you finance countries is through development loans that they have to pay back. So whether things work, whether things don't work, you're not actually interested in whether it's a shiny new pilot. You're interested in does the system get stronger. So perhaps you can tell us a bit about what you're willing to put your name behind in terms of AI readiness.
Sure, and thanks for that question. I think I'll also step back for a second. So yes, we are principally a financing entity. And yes, our financing is through loans and the countries pay them back. But we are also a technical entity. And so when we sign a financing agreement with a country, we mutually agree on what that financing needs to achieve. And we're mutually accountable for that. So we do give technical guidance to countries in terms of how they should think about their investments, right? It's not an ATM, you know. And it's also not a commercial bank in that you give the money and you forget about it, right? So that's not how it works. So the model is a little bit different. We are held accountable for achieving targets. In fact, there's a target I'm behind on right now that I'm being chased by my manager. Like, why are we not achieving this? So there is accountability. It's not like there isn't. But we are a lending entity, and so we are risk averse in that sense. You won't see us funding too many shiny pilots, right? But what we are very well positioned to fund is the boring stuff. And I was just saying to somebody, I should get a T-shirt made that says "boring is sexy," because nobody wants to fund the boring stuff. And our financing flows to governments over multiple years at significant scale. So it is actually very well set up to function digital public infrastructure, which we've been talking about since before AI was cool, right? Now it's become even more important. So that's kind of what. It's not like we will not fund risky things. We will, and we'll get to that. Where that tipping point might be. But it is that I just want to say that I think we're best positioned to function to fund those large-scale investments, including in energy infrastructure, connectivity, that actually makes the platform for everything else to be built on. Yeah.
Great. So from your perspective then, what tips something from being interesting and something that you can fund to being too risky to invest in?
Right. So we're actually, from an AI perspective, I'll be honest, we're figuring that out. And as you'd imagine, our approach being a development bank is a risk-based one. Right, so what is the risk, and how do you figure out what's an unacceptable risk, what's a high risk, what's an acceptable risk, and what measures do you then put in place to mitigate against high risks? So we're figuring this out. I can share we have an internal draft of this. I can't share the draft right now because my legal team will kill me. But basically, there are risks we will not take, and I'll give an example. Something like a fully autonomous system that does diagnosis without human in the loop, we would not fund that. But something like a chatbot that is screening for non-communicable disease, we actually are funding that in the Pacific. So yes, with human in the loop, with monitoring, with learning, with risk mitigation, we are funding that. It's actually happening in the South Pacific right now. They're working on the risk mitigation framework for it. So that gives you a sense of kind of, it's not there's one line, but that gives you a sense of where we will go and where we won't go. I hope that's helpful.
No, it's incredibly helpful, and I think we have sort of the lay of the land from each of you of the perspective that you're coming from and what you're thinking. So we'll delve a little bit deeper, and sorry, I'm going to keep coming back to you, Ali, for the next question again. When a country is negotiating a loan with you and you're saying that you also provide technical assistance, there isn't such a thing as a public sector company that's going to build this infrastructure, right? You're going to be contracting with private vendors. So how does the bank support the countries to ensure that they get the right vendors in place, given the risk that's being carried that they have to pay the loan back? If it doesn't work, if it's a failure, they're paying back something for nothing. So what kind of support do you provide to avoid those risks?
Yeah, that's a great question. So when we design the project, we get into quite a bit of detail with the country about how they will go about doing what they want to do. And so at that point, that's where we start to shape conversations like, does this fit into your long-term plan? Does it align with your health priorities? Is it a shiny object? Is it not? How do we approach this? And then when the countries request our assistance, we will recommend or suggest, look, you might want to talk to these 6 people. It won't be go talk to this one person or 2 people. We'll give them a sense of what to look for and how they might approach these people. We have also been in conversations with countries to understand how they might want to move forward with different vendors. So it's not like we sit and say, look, go with Google or Anthropic or Cure AI or whoever, never. But we'll give them a sense of what to look for in their vendors, and we also will help review their things like their RFPs, for example, to make sure that they are getting what they want when they ask us to. They're not required to do that. But if they ask us to review a TOR and RFP, we'll do it, to make sure they are getting what they want. Because, many of the countries we support actually have a really hard time with procurement. They don't know how to structure procurement documents. What do they ask for? What should the conditions on vendors be? How do I protect myself from vendor lock-in? So we do give them that kind of guidance to help kind of the investment pay off, both for them and for us, because they go into debt, right? So it's not a small bar, So it is important that it works out.
Great, and we know that these systems can be expensive, so we're not talking about a small amount of debt. We're really talking about something substantial. This model, the bank's model, it runs through development loans, worked out directly with the governments. That's your negotiating partner, and then you've got guardrails on what you will and you won't fund. Matthew, Welcome's model, you're a research funder. So you're working with different partners, but you're headed towards the same goal, which is AI-enabled healthcare systems. So how does your system work, coming from a different place? Where do you see that the sequencing matters? Where does it converge with what Ellie is talking about, and how do they intersect with each other?
Yeah, so in terms of the way we operate, so Welcome is almost entirely based in London in terms of staff, but we are a global health funder, and so that presents a kind of fairly key challenge for us, which is how to enable kind of local and context culturally relevant decisions to be made in countries. And we can't do that from our offices in London. So the way we tend to operate is that we will identify trusted partners in order to help deliver funding vehicles for us to enable this research to happen. And so a recent example would be our Evidence for AI in Health initiative, which we funded together with Gates and the Novo Nordisk Foundation. And through that, the premise of that was entirely not building new shiny objects, but taking existing tools that have been trialed elsewhere, and there could be an opportunity for rigorous evaluation of those tools to unblock a particular health-related challenge in a low middle-income country. And we worked with local partners in order to deliver those RFPs and those eventual funding vehicles that we'll look to announce shortly. But that's the essential mode of operation, that we look to identify local trusted partners who understand culture, context, and what is needed in order to help make those decisions. And then where we sit in relation to kind of World Bank kind of funding streams, I think in general we are earlier in the pipeline, right? We're funding the research and the evidence base that we hope, and I'd love to see the draft of your thing as well, Ali, if you're willing to share it, that we hope then can feed into those actionable decisions on what countries can pick up, what they can get loans for to help transform their sort of healthcare pathways and healthcare systems. And so we really look, in that EVA initiative we funded, we've got 2 tracks. One is for sort of earlier sort of validation tools and technologies, but then the second track is, these are well-validated tools. Now we're thinking about health system implementation, cost effectiveness, what are the sort of longer-term outcomes that you're looking at in that complex health system. So we are really looking to kind of push further down that route.
Great. So we've talked about who's funding the evidence base. We've talked about who's funding the system. But what we hear consistently throughout this conference, throughout many previous discussions, is that without the regulatory system in place, without the laws and regulations to make sure that things are well governed, all of this could end in failure. So Marco, what's your read on this? You're from a governance regulatory perspective. So is it just that people don't fund the governance part? Are tools and systems easier to fund? Or should that funding come from elsewhere?
That is not my experience, in the sense that, in the sense that the governance per se, again, is another piece of that jigsaw, because, as rightly pointed out at the beginning of this conversation here, we are building an ecosystem. Governance is part of that ecosystem. So we do have, in relation to data, in relation to, in general, the infrastructures, the computing abilities, also funding that goes into the governance per se. If we just take the examples of creating, say, the European Health Data Space, which essentially will be let's say, a way of enabling citizens to go around in Europe with their health data and share it, no matter what language it is spoken in another country, no matter what health systems they are in. Well, clearly you need to fund the digital part of the equation that supports that. Clearly you need to fund the structures to collect that data, but you also need to fund those who will agree on how do we standardize, the data for going from A to B. And this is part of governance, and the things cannot be distinct. So my experience is that it's part of the jigsaw and is one element important to consider.
And can I ask a question to all of you on stage? So who funds the governance part? Anil, do you want to jump in there?
Well, I think everyone should. So what's coming to mind for me, in the spirit of your prompt, Melanie, to be honest, is to avoid a false binary between pilotitis, and if it's not pilotitis, it's good. Because even some of the large-scale programs for which government is engaged does not mean that it's government-owned, and it still can be a single use case of AI. Right? So there's a great proposal for a country which says, let's use AI to connect existing data systems and avoid fragmented electronic medical records, and that'll go everywhere from the digital health wallet for the patient to clinician support. Great. That's a single application of a capability. And I think what we're talking about is the need for countries to have an AI investment plan for health, which sets out what is the regulatory approach, what are the guardrails going to be, how will we evaluate different AI applications, and that's a single costed plan. And everyone should fund it. So any project, like the one that I just mentioned, right, whether pilotitis or large scale, has a line item, just like overheads, just like a university says, we ask for this much money to go towards our general infrastructure. I wonder whether or not right now our encouragement should be a single costed plan per government for how AI will be regulated in health. And anything that is funded in that country that touches that contributes to a single vehicle, which is that plan. Because otherwise, we're treating it, the line that was just used was a piece of the jigsaw puzzle. What came up for me is I don't want it to be a piece of the puzzle. It actually has to be the foundation so that any piece that's on the board is also funding the board.
I really like that analogy. I think if we just talk about bits of the puzzle without having that one overarching plan that everyone's funding around and crowding in so that the single plan that the government is behind gets funded, we're going to end up with increasing fragmentation of the system. So, Marco, you have something that you would like to share here?
No, it's rather reacting to let's say, your narrative shapes realities. One may also elaborate on the story of electricity, especially since electricity, it's not necessarily an agent of change, while AI it is. So it's tricky as a question. The real matter is whether, and that is my message, is that when you depict the instruments that will deliver at regulatory stage the infrastructure that you need and the collaborative elements that are part of the game, this has to be a unified vision. And I totally agree. Now, to get there, you need to have a structure that allows this diversity of views that they may emerge from diversity of health systems, from diversity of cultures, from diversity of values. And that is per se an element that requires time. So it's not something that you do from one day to another.
Great. So I feel like we're all converging around this need for a common framework that Ana Luisa has presented. But we're all coming, it's like the elephant, that you all see a slightly different perspective on how it's going to tie together into an overall piece. So before we move on to the next round of questions, I'm going off script and just going to ask you all, what would success look like in this space? Like in a couple of sentences, if we could have a framework that ties everyone together, that everyone's funding around, in 2 years' time, what would we hope to see as improvements on the ground? And Neil, I'm going to put you on the spot to start.
I'd be very interested to ask the government representatives in this room for contribution to this, but what comes up for me is success must look like a clear metric associated with country ownership, so that whether it's a single costed plan, whether it's a civil servant who has responsibility for this, whether it's a line item in the budget, that it's not, again, I'm going to avoid the use of pilotitis because it's easy to dump on pilotitis, but it's 4 different large-scale programs, each with different vendors, each with different partners, each with different budgets. And so success has to look like something that ties back to government ownership and coordination. And what that is, I think the government representatives in the room should define.
Ali?
that's a tough one to follow, given that my customers are government. Absolutely, I think that I will respond also to a point you made about the framework, if I may. So for digital health, and we consider AI part of digital health in our thinking, we actually have a methodology to create costed roadmaps for digital health, which fund governance, they fund infrastructure, they think about human resource capacity in a 10-year roadmap, which also lets you model ROI. So we actually have that methodology in place. We have to add AI to it explicitly because AI is a little bit of a wrinkle. But I'm really glad you brought that up because that's something that we realized, and we actually have a published methodology for it. So just to share that. In terms of success, I think that absolutely it needs to be run by government. And I think that for me, the articulation of a vision and how that vision can be achieved, I would call that success. I mean, once you have that in place, then you figure out where the funding comes from and all the other things. But just having a vision is not good enough. Having some concreteness as to how you'd achieve that and what you're doing that for. What are the priorities you're trying to tackle, right? It's not just, AI for what, So it has to be grounded in the health priorities in the country, has to be government-led, and ideally should be costed. And then we can figure out where the money is coming from. And we're seeing this happen in countries that we're supporting. So for us, having a plan and then coming to us with a request for financing just makes it so much easier to de-risk the investment and then to figure out how the financing can flow. So I would look at it from that perspective.
Matthew.
Yeah, so I would completely agree with Anil and Ali on asking kind of government representatives what they think on this one. I would certainly hope that we can build an ecosystem off the back of good research and evidence base for these tools so that everyone is working from a transparent understanding of what they provide or what they don't. I think actually there is a risk of, because there's so much enthusiasm and excitement around AI and health, there's a risk of a kind of over-indexing and you get a kind of lumpy sort of digital infrastructure within countries where you have redundant systems spun up for particular services where they could be deployed or used elsewhere as well. So just understanding actually that digital infrastructure piece, I think it was the representative from Morocco earlier who was talking about sort of building up data centers, the energy problem, but also the water restriction problem. Like these are going to be real issues, and you can't restrict that kind of infrastructure just to health problems. And so it needs to be dealt with as a kind of country level approach.
Great, thanks. Marco, anything to add?
I actually would, I completely second that views, and for me specifically in relation, so what is the let's say, the scope of our interventions if we limit to, let's say, AI in health for specific reasons? I guess that the measures of success would be that along the investment chain, from research and innovation to post-market surveillance of the technologies that we develop, we do succeed in creating an ecosystem that first delivers a solution that is trustworthy, second, that delivers a solution that can be adopted at large to deliver healthcare benefits to everyone, workforce and the citizens, and third, that it also supports competitiveness in general and economic forces. That's how I would say.
Great, thanks. We will come to some audience questions at the end. So to come back first to the framework that Ana Luisa presented. So I think we've all touched on the fact that frameworks are good, that a standard approach would be very good. So asking to you guys, what would it take to actually have a framework like this make you decide to allocate more money? What's the tripping point? So, Anil, what would it take for a framework like this to feel actionable to the donors that you work with, rather than just another set of principles, another document that sits on a shelf? What makes it work?
Absolutely. So let me answer that, but pause for a moment to just talk about the money that we're going after, because I think some of us have some vague sense of it, but I just want to make sure to align us. We are right now this year witnessing the creation of the largest amount of private wealth in human history. And I just want to walk through that. The 2 leading AI labs are likely to go have their IPOs at the end of the year at roughly $1 trillion. One of those, the founders have pledged 80% of their money to philanthropy. The other one has a foundation that on IPO will become bigger than the Gates Foundation. And if you add all of that up, the understanding, I shouldn't say the speculation, the estimates are that that will translate to $100 billion of new giving per year. That is an enormous amount of money, and it's going to go somewhere, and none of those responsible for those funds have ever given a health grant. That might be a bit of a caricature, but for the most part, right, they've been in the business of business, not philanthropy. So there's a lot of money on the table, and there's a lot of speculation that that's going to go towards AI safety, and I think a lot of this conversation is actually, we all agree it needs to also go towards AI readiness, the readiness of deploying the capability, which in many parts of the world isn't present. So how, now coming, Melanie, to your question, how do you translate all of that wealth into some grants that do a lot of good? And I'm going to come to the term that Ali used, which is the only time it's been used on this panel, which is ROI. And I think this is challenging, because when we talk about infrastructure, it's hard for us in this community to use the language of outcomes, because no, that's too many steps away. And what I'll share with you is 20 years ago, the first grant I ever raised for the World Health Organization was for its pre-qualification program. Regulatory work, right? This is not sexy, infrastructure. And the way we sold it to a donor was, if you give this much money to the pre-qualification program, this is how many people who are going to get treatment for HIV. Because there is a direct correlation. And so there's a theory of change between the infrastructure investment and the outcomes that will be achieved. And when we think about AI in such a fragmented way, we have a really hard time quantifying, articulating the outcomes. Ali has to have those outcomes, otherwise he can't make a loan. I think that the answer to your question is that we have to get much better at speaking the language of those who are going to have the money, and their language, it's not that they don't want to fund infrastructure, but they have to know what outcomes will be achieved as a consequence of that investment. And that's the language that we have to get better at.
Excellent. So Ali, does that resonate with you?
Absolutely, and you asked us to be honest. So I think that when I looked at the framework, the one thing I would suggest thinking about is what I did not see in there was outcomes, actually. So, and I know it might be early days, right? But clinical effectiveness alone is not good enough. It has to work in the context. So it can be FDA approved, it can be as good as a physician, but if it's not delivering health outcomes, I can't justify funding it. So I did not see that in the framework. Maybe I missed it, but I would suggest thinking about that, because for us, that's the deal breaker. The risks are obviously we factor in, but if it's not delivering health outcomes, I can't fund it. So it comes down to that at the end of the day. Yeah.
So you need the ROI and longer term, not just short-term clinical outcomes within 1 year. You want to know in the long term how many lives are going to be saved.
Yeah, and like our ROI model actually, unfortunately, has to translate that into dollar returns, right? Because that's what people in finance want to hear. So I hate to put a value on human life. It's pretty awful to have to do that, right? But if you want to convince the Ministry of Finance, you've got to talk dollars. That you can't talk lives. It doesn't resonate. It resonates with the health people, great, but not with the finance people.
Yeah, and it's something that makes people working in health generally very uncomfortable. The whole discussion around value of statistical life, how do we value absenteeism, presenteeism, early death. We don't like it, but we have to do it.
I'm a health person at heart, and it makes me very uncomfortable, but that's what you've got to do to make things move.
But if a framework such as this could help the health people talk more easily to the banks, the donors, etc., then it could find a niche to unlock some of that finance that maybe is hard to get to the end point of agreeing the loans.
Yeah. So not to harp on our model, but what we did was we basically say, look, if you avert this many DALIs, this is what it translates into in GDP. Yeah. And that is the argument that makes sense to some folks, right? It's unfortunate, but it does.
Yes, having witnessed these discussions take place, yes, that's the argument that makes sense. How much GDP will increase by reducing the DALIs? Marco, do you need another framework like this from where you sit? Would this be helpful to you in some way?
Well, actually, following the presentations, I don't think that there is a major difference with the framework in general that is being used, from priority settings to general operations and implementations of work that we use. So certainly it's an interesting tool. It's an interesting set of lenses to look at the problem, right? And then I would say that I totally agree with the interventions that these lenses, they are also, let's say, a little bit dynamic. They will need to have flexibility and dynamics, because if we need to reach, say, the local level, as well as the level that is at, say, regional or national levels, then these 4 or 5 levels requires a framework, but they also say require a level of flexibility, and that it has, as you pointed out, systems for reflections between the stakeholders, that it's quite important. So here, top-down or bottom-up, it's not something that would work any longer, and especially on healthcare, especially if you have to take into account the specificity of the local level where you are delivering healthcare services. So yes, it's a complex landscape to address.
And Matthew, where do you see the evidence base fitting into this framework?
Yeah, so I think that, and you already mentioned the kind of validation in context, which is a key component, and focusing not just on technical outcomes, but on outcomes that matter for future uptake, including kind of economics, cost effectiveness, et cetera, would be very important. I think often these frameworks, and as Anne-Louise, you mentioned, actually embedded within these are lots of different types of AI and deployment scenarios, et cetera. And so understanding for people who practically are trying to use this in their specific context, how you give them tools to actually sort of deploy it in these particular tracks, I think is pretty critical. I liked, especially in your presentation, how you said the first question is AI the right thing in this context, right? Because I think often it's too much, a hammer searching for a nail. And so have you explored other options is a pretty foundational piece. And that kind of overarching framework, just as an example, we saw this in the UK with that sort of MHRA guidance on software as a medical device, and that framework exists, but people were really struggling to engage with what it actually meant for their tooling, and which is why we funded them, not to change any regulation, but actually just to really lay out the guidance. And actually, I think that was the first time that people understood where ambient scribes fitted into the UK landscape, was through, and it was in digital mental health guidance, but actually that is now relevant across all different areas. So really providing that detailed explanation, those practical decisions people are making and how that flows through.
Thanks. So we're going to just since a lot of people raised the need to hear from the country participants in the audience, let's take a couple of questions and then come to the final roundup here. So are there any questions for the panel? Any of the panel speakers or Ana Luisa on the framework? Perhaps everyone's just getting a bit hungry. No questions? All right, then would you like?
Everyone, I'm Helen Caton-Peters with WHO Europe. I think I know most of you. I think just a couple of comments. This is a framework that I've been working on with the team for probably quite some months now, and this is a draft. But to the point of the member states, we have absolutely involved them in the consultation process to ensure that they have that opportunity to be able to reflect on what works at the governmental level in their countries, and also to the point of outcomes. We gave you just a very sort of vague view, I think, of kind of the key core principles, but absolutely we have the context of tying to national population health and public health goals. So it's really all about building around that strategic value at the country level in gathering insights into health. So the structure is built around that. And then the part that we are working on next is on the use case component. And so that will really be what are the success criteria built on the roadmap that we developed through the framework analysis in the beginning that will then prove successful use cases. So you are investing in what is needed. You are investing in what the countries have defined for themselves to be important. So it will go into a consultative process from here, and we would be very happy to hear your inputs and insights into that from here, but thank you very much.
Thanks so much. So Ana Luisa, did you want to share any reflections on what you've heard?
Yes, I will, and there's so many points. I'll just try to pick up 3. Thank you so much for the discussion, and well, I would say all of these comments really echoed with what we have been discussing as well. So I'll maybe pick up on the first one about objectivity, about getting case studies, the second step, which of course I presented quite quickly, but we completely agree with that. We need the case studies, which is the second part of the framework, apply it in 2 or 3 specific cases with specific metrics, show the impact. And the main reflection there is different places will have different case studies. It's not a comparative exercise. It's about getting the right case study and the right impact for that context. So we completely are completely aligned on that point. Second reflection, and I really like discussion around why investment on regulation and governance sometimes gets a bit parked. I really like your comment, Ali, on making it part of the single costed plan or metric. I think that makes so much sense. And I was reflecting, why does it actually get parked as a separate thing? Because it shouldn't, right? What historically might have happened. And I'm, from an evaluation perspective, which is more my background, and correct me if I'm wrong, evaluation is relatively straightforward in the sense that we have a recipe. We know how to evaluate. There's so many World Organization frameworks for digital health evaluation. We know the recipe is relatively straightforward. But getting regulation and governance locally right, it seems a much more fluid and a much more difficult and complex exercise. And I wonder if maybe a little bit more costly than we anticipate as well. But I'd be open to... So we have these very interesting and broad, well, huge advancements on regulation at European level and global level. But again, taking that step that you mentioned, Matthew, how do we make these kind of things work locally? It seems to me sometimes a bit of a more complex and difficult exercise, and much needed, but I completely agree, and I really liked how you frame it about making it, embedded in the single cost plan. I would maybe go back to this boring is sexy to finish. Again, I think how we frame this basic foundation that we require and how sometimes we deviate from the basic foundation because other things are faster, sexier, more appealing, I think it's an increasing risk. And then we also see that in evaluation. I completely get your point, Matthew, on we need to, well, there's this tension between pilotitis and actually do what matters. But at the same time, we also need to understand what doesn't matter or what doesn't work quite quickly. So there's this maybe positive side to pilotitis, which is understanding what doesn't work and understand that quickly. And my final reflection on that, and this is an overall concept in digital innovation, we are threading a brave new world. We are doing innovation in healthcare. And innovation tells you, fail early, fail fast, right? We need to know it quickly. But when we do innovation in healthcare, we cannot afford to fail fast or to fail quickly because there's people's lives at stake. So we are talking about 2 different ways of working that we're still trying to bring together. Thank you so much.
Thanks very much. And yeah, we can't afford to fail fast. So a last quick reflection from each person on the stage. What is one thing WHO, member states, partners could do differently that would really help to unlock investment in AI? Marco, we'll start with you.
Differently? No, I would suggest that you keep doing what you're doing.
Excellent. Thank you very much. We're doing a good job. Thank you. Matthew.
Yeah, I mean, I think having those clearly sort of planned sort of strategies and then that focus on what is the interoperable component, because actually then when you step it outside of country level, having these building blocks that are interoperable are the things that enable you then to respond as regions to kind of public health emergencies, outbreaks, etc. It's become so much easier from a data perspective. So, yeah.
Ali.
Yeah, I'm going to double down on the costed roadmaps. And if you need help to make one, we can help do that. So we have resources that are outside of country loans that we can use to help you make those roadmaps. So if you need to help make a plan, talk to us. The plan makes it much easier.
Anil.
Think of AI as a capability, not a tool. So electricity, computing, internet, I mean, there's several examples. And in doing, reinforce the need for the country plan. So this is not incrementalism on an existing health system. This is transformation. There's a huge opportunity. And making sure, I just think we live in a mindset of scarcity right now, right? ODA's fallen down, our friends have lost their jobs, tough times out there, people's health services have been impacted. And I'm just trying to reach in and actually turn that around and say, how do we think of this as a moment of transformation, fundamentally new capability, with a single costed plan associated with outcomes with common readiness framework, so that we're not all doing different things, but there can be a country plan, and frankly, not a WHO plan, but a country plan that WHO supports, that all of us get behind, because we're not allowed into the country, we're not allowed to write a check unless it's supporting that country plan.
Great. So it sounds like there's actually some fairly good convergence. You got a small round of applause there for that. So we can't separate the AI investment from the investment in the foundational digital infrastructure, the DPIs, everything that's needed to create interoperable data, cross-border portability of data, etc. It's all connected. We're not talking about AI investment in a vacuum, but as part of a broader system. So if we think about the takeaways, we need country-level ownership. This is not about WHO having a plan. It's not about the World Bank having a plan. It's about the country having a plan that everyone is behind, everyone participates in, and everyone puts their finance into that same coordinated plan. We may have heard this before. So we're not reinventing, we're just reinforcing what we've all agreed on in the past through many different forums, which is one country, one plan, with donors investing around it. The plan has to be able to show return on investment in order to unlock that larger investment loans from the banks. But it has to come with a monitoring and evaluation framework so that we can have the checks and balances, make sure that pilots, when they go to scale, they keep working and they keep bringing value. And finally, we should think about AI as a capability, not as a tool. It's not just the new shiny object, it's something that needs to be invested in, needs to be across the system, it needs to permeate, not just exist on its own. So I think if we go away from this, building on the framework that's been developed and thinking about how do we make sure that ROI is there, that connection to the broader investment in DPIs, etc., is there, we could be in a good place to move forward together, thinking about one country, one plan, and really building that investment need for AI into the future. Thank you all very much for listening. I think we're not too delayed into lunch. Thank you to the amazing panel for their contributions. And I hope we've all learned something about how these different funding flows work today. Thank you very much. And back to you.
Thank you very much, Melanie Bertram. We will now have a 90-minute lunch break in which you can deepen the conversations. Kindly reconvene here at 2:30. Thank you. Welcome back to our final session of the conference. I hope you had a nice lunch break. Over the next 75 minutes, we will take stock of the WHO Global State of Readiness Evidence and Implications. Please join me in welcoming our moderator, Alain Labrique, to the stage. Please, you have the word.
All right. Good afternoon. Bon dia? Bon tarde. There we go. I go with human intelligence, not with artificial intelligence. So here we are, the last stretch. I know we have plenty of energy left after 4 days of conventioning, conferencing. I know it's been really great because, again, I'm going to quote our distinguished colleague, that many of us are not the same person we were when we started this week. And I think there's been a lot of excitement because of the side conversations. And that's often where the richest magic happens in these sessions, where we meet people over lunch, we meet people in the intersessions between sessions at the coffee breaks, and we make those contacts with people who then have a lot to share, both during the meeting, but then most importantly afterwards, when we realize, oh, there's something in common with those individuals. So this session is an exciting session because it's an opportunity for us to reflect back as WHO what we have been hearing from member states. It's an opportunity for us to also listen and reflect back and make sure that what we're hearing is in fact the priority that you as countries have expressed. And as we go back to our regions, back to Geneva, that we together as one WHO can sit down and reflect on what are the things that we need to do moving forward, both as we prepare the next global strategy on digital health, but also as we embrace the rapidly moving bullet train that is AI. And we do so reflecting the conversations of last week in Geneva at the AI for Good Summit and the high-level dialogue on governance, but also the really important discussions that were held here in Lisbon. So without further ado, it's my privilege to invite the distinguished panelists and friends and colleagues from all 6 regions of WHO. And if you want to just come up and take your very comfortable seats, let me welcome to the stage Dr. Benson Droti from the Afro office. Benson, welcome. Next, let me invite Mirna Marti. Dr. Marti, where are you? There you are. Welcome to the stage. Be very careful. These steps are a little bit precarious. So next, Novera Ansari from the Eastern Mediterranean region. Novera, welcome. And you know, yesterday I mentioned this is the postprandial session where all the blood is rushing from your brain to your stomach, but clapping uses about 12 calories. So the harder you clap, the more you will use those calories. And David Novio Ortiz from the European Regional Office. Welcome, David. And Kartik Adapa from the WHO CRO, Southeast Asia region. Welcome, Kartik. And last but not least, Roland Dilip Kumar Henson from the Western Pacific Regional Office. So Dilip, welcome. So that's about 100 calories that you guys have spent in applauding this amazing group of people. And it's really, I will say, been a privilege and a distinct honor to work alongside all 6 of these amazing technical colleagues of mine who have been at the driver's seat of supporting countries in each of these 6 regions of WHO. And I think sometimes the work that they do on a daily basis is both unglamorous, as we mentioned day before yesterday, because it's the hard work of helping write strategies and helping think through architecture and helping to pair up what countries are asking for with the correct technical resourcing and partners. And so really want to appreciate the work that every single one of you does on a daily basis to advance WHO's mission in the world. So as we start this panel, one of the things I wanted to just reflect on is something we shared on the first day of this meeting, is how central this conversation on digital transformation and artificial intelligence is to every single one of our 193 member states. The fact that during the most recent World Health Assembly, there were no fewer than 42 events that countries were leading, where ministers were speaking about artificial intelligence, interoperability, governance, digital infrastructure. This is an unprecedented sea change in this global dialogue. And so the themes that countries were bringing up as priorities for WHO to support are here on the right in terms of governance and financing, architecture and infrastructure and systems, capacity, the human beings behind those systems, and last but not least, the governance and oversight of responsible artificial intelligence. And these are the same themes you've heard echo again and again in every panel that we've had over these last 2 days of the conference, and before that, the 2 days of the technical workshop with the member states. But there were also some cross-cutting asks that I think go beyond these 4 pillars, and those include, and this was a theme both today and yesterday, that AI without data is not going to be implementable at a country level, whether that's data that's reflective of the setting in which it's being deployed for the AI to be trained on, or data systems just as the base of population health, understanding patterns and trends of morbidity, mortality, so that governments can be sure the programs that they're investing in are responding to real need. The second is also the foundations for equity and rights to make sure that these systems are reaching everyone, not just those who can afford more sophisticated technologies. But then last, and this is where we as a collective, the entire WHO family, thinks about our role as servants to the countries who make up our executive board and the governing bodies of this organization. To the asks that you're putting to WHO in terms of setting the norms and standards, helping to develop the baseline architecture, to convene this kind of multi-sectoral dialogue and multi-member state dialogue where we can learn from each other and cross-pollinate, not just within a region, but across regions. And last but not least, to help build capacity and to monitor progress towards global goals and towards this evolution of technology. Before we jump into the session, I just wanted to leave you with a quick wrap-up of 4 questions that we collectively have been hearing from member states over these 2 days. And I'm not going to read through the questions because your brain will process them faster than I can read, but really the questions we keep hearing, both in our conversations at the regional level, as well as in our conversations with you here, are around capacity. How do we assess where we are and where we need to go? What is the minimum set of investments we need to make to be ready for AI and digital transformation? What's the sequencing of those investments? We had a number of countries come up and say, we're at the starting point of our digital journey. What do we invest in first? What are the first foundations that we build? And then what are the quality control mechanisms? How do we evaluate the vendors that are standing outside the minister's office, selling us solutions, some of which look very good, but are they really fit for purpose for our country? And last but not least is countries asking, do we have the regulatory and governance mechanisms in place to ensure that we are adopting AI in a responsible way? With that, I will share with you again this QR code that leads to the reference architecture that was just launched yesterday. Some of you have already begun sharing interesting comments about this. But this is one of the efforts that spans all of our 6 regions, working on developing that roadmap towards these 6 objectives. How do we transition from fragmented health information systems towards integration? How do we build a well-governed system that serves public health and clinical needs? How do we unlock and enable local entrepreneurs and innovators to participate in public sector priorities? And how do we ensure that what we build and maintain is affordable from our country's perspective? And that's really the critical question. Over the last several years, especially in 2 or 3 of our regions, we've seen catastrophic loss of function as donor funding was withdrawn from systems that should have been in the hands of government to steer, control, and manage. And that was not the case. So we need to build back stronger and more resilient. And then the last is, how do we work with partners? And I know we have our colleagues from the World Bank here. How do we, across our 6 regions, work with the development banks who are investing in those country capacities so that when the World Bank or other development bank makes an investment, they can be assured that those investments are being put in the right place to achieve these shared goals across our 6 regions. So with that, I'm going to first give the floor to our colleague Benson from AFRO. We're going to go in alphabetical order through our regions, so you can already start to sequence where you are in that order. But Benson, if you can tell us a little bit about where the countries in your region stand, what are the questions that they're asking, and then what we've asked each of our panelists to do is put together a set of QR codes of salient resources for the region that they wanted to share with the audience today, both of you in the room, but also the many of you who have joined online. So even though there are empty chairs, rest assured there are many, many people watching you online. So your words have a lot of weight. So Benson, over to you.
Yeah, thank you so much, Alan, and good afternoon, colleagues. WHO African region has 47 member states. Yesterday, we heard from 2 of our honorable ministers of health, the Minister for Angola and the Minister for Guinea-Bissau. The Minister for Angola highlighted the remarkable progress that the country has made in advancing digital health and also creating an enabling environment for deploying artificial intelligence. In contrast, Guinea-Bissau minister highlighted the important gaps and the fact that the country is still at the initial phase of AI journey. These 2 perspectives shared by the 2 ministers actually reflect the diversity of readiness for digital health and artificial intelligence in the African region. Across the region, you'll find countries that have the capacity that can easily be classified as nascent, and also there are those that will have capacity classified as moderate. At this stage, I don't think there's any country in the African region that can say we have advanced or sustainable capacity for digital health and artificial intelligence. Having said that, one of the questions that we often battle with and also that we get asked by the countries is, and Alan, I was disturbing you on the first day about this as well, how can you meet us at our current level of readiness? What are those innovative ideas? Should we have full readiness before we can start implementing or deploying some of these solutions? So this is the question that we are actually battling with quite a lot. And we are hoping that working with colleagues from WHO headquarters and also all of you here in the room, we'll be able to answer that question. Yes, countries in the region are still, all these foundational issues we talked about the past few days, workforce, digital literacy among health workers, computing competence, and many of these financing, they are huge challenges for many of the countries in the African region. So the issue then for us is, okay, how best do we meet them where they are, not wait for them to be ready to deploy some of these solutions. So I'll stop here. Maybe if there'll be opportunity to say more, I can say that afterwards. Thank you so much.
Sure, and I think that's a great way to kick us off, Benson. And I think as we all hear from each other, feel free to just comment or reflect on how there are similarities between the regions, because I think that's been a theme of our discussions over the last 2 days is, whether we're coming from Central Asia or South America, there are shared pain points and often shared pathways to resolve those pain points that we can learn from. So let me move next to the Americas, and we have Myrna here to describe your response to that question. Myrna, over to you.
Okay, thank you very much, Alan. And yes, we have discovered here that same diversities are shared among the regions. The Americas has 49 countries and territories, very different among each other. And inside countries, we face a lot of inequities and differences. We have a good opportunity, which is that in the Americas, we have a shared vision yet established. Since 2018, we have the 8 principles for the digital transformation of the health sector of America. One of those is artificial intelligence. These principles are part of a roadmap for the digital transformation of the health sector of America. So that part, for us at least, is solved. But the question or the requirements that we are having in countries is we need better regulatory frameworks. We are now in 2026 talking about or saying that the legal frameworks we change or we develop enabling telemedicine or enabling EHRs are standards or traditional regulatory frameworks. So they are now somehow obsolete because we need to work on regulatory frameworks that make AI, the countries more adaptable to AI. So for us, it's a big challenge because we work a lot to face the past 2-3 years challenge of adapting the regulatory frameworks for countries having digital transformation or EHRs or telemedicine or e-prescriptions, and now these frameworks maybe are a little old. So this is something that we need to think on. We are moving, we are trying to move always fast, but it's maybe not enough sometimes, or we feel that. So yes, I will pass the floor to other colleagues.
I have 2 hands. I wish I had a third. But really, great reflections, Myrna. And I think the 2018 shared principles certainly provide a region-level cohesion around not just principles, but also directions of travel. And I think the 2 areas which I just want to call out, one is the emphasis on capacity building. And if we just go back one slide, we see sort of the number of resources that have been made available in Spanish and Portuguese for countries in the region to strengthen their human capacity in this space. I think that's really critical. And then also regional technical infrastructure, like the Pan American Highway for Health, is one that we're looking at replicating in other regions as well, and serves as a common backbone for sharing information across the region. But now let's move across the ocean to our colleague Novera Ansari to tell us a little bit about the EMRA region. Novera, over to you.
Thank you, Dr. Alan. So let me briefly describe the Eastern Mediterranean region. It consists of 22 countries from North Africa, Asia, and Middle East. It's 10% of the world's population and hosts around 50% of the world's refugees. So I think that the first measure of readiness, we have to look at the digital health maturity. So that is what the countries are focusing on. And right now, we have 10 countries that have the national digital health strategies and 16 countries that have the health information system strategies. So as WHO, we are also encouraging countries to combine this and have a unified frameworks for health information and digital health. The second indicator is for health information systems, where a lot of countries are focused on data governance. Right now, we have 12 countries that are using DHIS2. So I think DHIS2 has supported countries in improving their information systems, standardized, patient registries and surveillance. The third indicator I would talk about is the AI governance. And what we have been observing that there's a rapid formation of governing bodies around AI. So whether it's ministries or councils, regardless of the country's income levels, all countries in the region are rapidly having the AI governance established, where health is, key important factor, that's there. And then also in the partnership, the role of academic institution. That is also something that is very much emerging, that I can say, where the academic institutions are supporting ministries of health. And we have two of our colleagues here who are also part of the universities and also supporting the ministries. So that's a good example. There are colleagues from Iran and Oman. So those are some of the key indicators that I would say are like showing the AI readiness for the region. Thank you.
So I think that's a really important reflection, Novera, because you have a very heterogeneous region where you have very, very high capacity countries with high income and very sophisticated technical backbones. At the same time, you have countries that are struggling at the very basic levels of infrastructure with sparse populations and a lot of socio-political challenges as well. So I think there's certainly a room to pause and reflect on the dramatic heterogeneity across regions, but also within regions. And the one-size-fits-all approach is one that we really have to look at and understand both the starting point, as both Benson and Myrna reflected on, but meeting countries where they are. And I think that's a really critical reflection. Moving now further to the north, we come to David. And David, you too have a heterogeneous region and a fairly large one. Tell us about Euro.
Thank you, Alan. So for those that don't know, the European region in WHO is composed of 53 member states. We are very proud that when it's about digital health and artificial intelligence, we have a clear overview. We conducted a study on the status of digital health in 2023, and then conducted another more recently on AI that was published late last year. So this is also giving us an understanding of what will be our priorities, because our countries are very, very demanding. I would like to differentiate what are the most frequent asks, so what we try to deliver when they're asking this ask, right? So the reality, talking without filters, is that not most of the time, I will ask to showcase some of the examples, we are asked to support member states in implementing a single piece of software, right? Or a single piece of solution. It could be about electronic health records, it could be overall about AI. And we are, of course, very proud that they look at WHO for doing this work and to reviewing these projects. But we try to work with the member states and reflect about what we really need, right? I was mentioning, so we have a workshop where we were talking about this a lot, between the public gaps and what the private sector is developing. There are huge gaps. So somehow we are found in between to really try to support to close this gap. So sometimes after receiving this kind of such requests that are quite high demanding, as you can imagine, talking to them and making them understand about the importance of the data and how systems are structured, and to have this readiness assessment, it helps to guide the discussions. So I think that there are always a huge gap also between what we are asked to deliver and what we should be delivering. So that is something that we are very committed. We have several tools. We have a roadmap for the European region. One is about digital health. Hopefully this year in October, it will be a roadmap on the use of artificial intelligence in health for our region. Then we also have conducted, the numbers that you can see in the slide are just numbers from the last years from 2022. But I will say that in our case, I think that as most of our colleagues in other regions, the main challenge is related to data infrastructure. And I think that we still need to continue working together to address all of this. Thank you.
Yeah, and again, we see, I think, with Euro, an interesting microcosm of the challenges that the WHO Euro is dealing with, that is, what you're being asked to deliver and what you should be delivering based on the maturity and readiness of the country. Is probably a similar struggle that many of our colleagues from member states are also facing when they meet with the minister or the cabinet to say, we want the advanced solution, but we also need to recognize that the investments have to be made in those foundations. And so I can imagine that's a shared challenge, not just within WHO. But certainly this readiness assessment approach, looking at what are the foundational elements, and we'll come back to that again when we ask the group about the necessary foundational pieces of digital transformation and AI. But before we do that, let's move now to our next region. And here is a region that I think is very interesting, because you have some very advanced countries that are pack leaders when it comes not just to the region, but really to the globe in terms of investing in digital public infrastructure and building those solid foundations. But then you have also countries who are trying to learn from that to move forward. So Kartik, over to you.
Thank you. Thank you, Alan. I think in Southeast Asia region, we essentially have about 10 countries. As UN, we don't engage with 2 of them. That leaves us with 8. Now, foundations is essentially the key hallmark of everything that we do in the region. So all 8 states, all the other 8 member states have an endorsed digital health blueprint. So that's the first step. Second is the emphasis is largely on digital and data foundations. So if you look into the work above, the first one is essentially on how do you build an ecosystem approach and not an ecosystem approach. So what we have on the top are all a variety of collaborating centers, partners that truly collaborate with WHO. The second one is essentially on how do you build digital health competencies and frontline workers. So around the world, when you think about building digital and AI competencies, we go top of the pyramid, which is typically healthcare providers, physicians, nurses, and others. Whereas in this part of, in this region, the emphasis has been how do you really equip the frontline healthcare workers. Now, the third one is on standards. So every digital health blueprint in the region there's a strong emphasis on standards, and that's the reason why we have a book chapter essentially written on some of the best practices on implementing standards from the region. The fourth one, which I wanted to highlight, is how do you think about governance? And there are.
Let me bring on our colleague Dilip, who also is dealing with a very, very complex and widespread region, which is almost, I would say, probably the most heterogeneous when it comes to differences between countries on many different axes. So Dilip, over to you.
Thank you very much. So yes, so the Western Pacific region is home to 38 member states and areas. And of course, when it comes to diversity, I mean, we have countries with some of the highest populations, over 1 billion people, and we have also some with just 10,000 people. So it shows you the diversity, and also in terms of digital maturity, it varies considerably across the region. So given the importance of AI, I mean, member states at the regional committee meeting last year had an important technical discussion as to how we should move forward. And there was general consensus that we should not wait for the ideal conditions. We should move forward. And for that, the main question that was put forward is, what is exactly light enough to act now, but solid enough to trust? So based on this, we have come up with a framework to present at the regional committee meeting this year. And it has 3 priorities. One, the first is use case prioritization. Now around this, we have a very simple or a very kind of concrete set of tasks or asks from member states. First is a clear catalog of use cases of AI in health to see what kind of applications are run in what kind of settings and approved by whom, and exactly what kind of health challenges it addresses. So this is a very solid ask from our member states to put together a use case compendium. Second is a very practical risk classification tool, moving away from abstract frameworks. So they've been very clear, no more abstract frameworks, we need a very clear risk classification tool. Now, second is support to build the minimum ecosystem. So given that that countries would identify their way forward with different use cases, to identify the minimum that is required in terms of an ecosystem to run those priority use cases. And then there's also a specific ask on health data governance. We are in partnership with Transform Health, and we've been supporting countries to review data governance frameworks and identify clear gaps and support them on that. Then local and regional validation evidence is another clear request from member states. And of course, then comes financing, not just the tools, but the entire ecosystem. But of course, this is quite a complex ask. Thirdly, the requirement from us is to help strengthen capacity among health workforce, to really have role-specific skills, to develop competency frameworks, and to also develop training courses to really support, to build capacity. And of course, specifically from our Pacific Island countries, the request has been shared regional models and tools, for shared regional models and tools so that they could also adopt tools which they might not be able to build by themselves and operate alone. So these are some of the very key or very specific asks from our member states. Thank you.
Maybe this is so you know, you've talked a lot about this minimum ecosystem and building those conditions for digital transformation and the adoption of AI. Maybe to bounce the ball back through the chain here, Wipro has some unique geographic circumstances with the small island countries. Could I ask you maybe to reflect a little bit on some of the infrastructural challenges that sometimes across the board here, we jump across that question because that's a given predicate that we need in order to do anything related to digital or AI. Without electricity, without networks, without reliable connectivity, without data capture and data storage, you know, all of the things we talk about are strained severely. So I'd love to do just a rapid fire bounce back down the line to have you reflect on these infrastructural challenges and how
Indeed. I mean, these infrastructure challenges are real. I mean, we are talking about environments that deal with day-to-day issues relating to electricity outages, water shortages, and then we are talking to them on AI. And certainly, this is where I think sub-regional partnerships come into play, because these are small island countries who alone can't really address these infrastructure gaps. And coming together, especially in terms of, for instance, there have been a number of countries that have been interested in trialing AI for diabetic retinopathy screening, but then the number of training data sets from the Pacific eyes is so small unless many countries come together and really agree to share this data for a sub-regional kind of an initiative, these things would always be a hindrance to them. So partnerships here, regional partnerships would be key here.
Fantastic. And I think that's a key role that WHO can play in terms of convening and bridging those natural boundaries that then allow for something that everyone can benefit from. David, the ball's in your court.
Thank you, Alan. I'm going to reroute your question to something else. About infrastructure. So I think that I have always said that, I mean, all of you I think the same. Usually the Ministry of Health cannot pay for the infrastructure, right? So what is the challenge? So that is the reason I usually, when we're talking about the missing foundations, I always mention three. One is digital literacy. We have talked a lot during these days. That is something that the Ministry of Health should be leading, and we can do more. We have, at least in our region, data, but it's looking how, when it's about digital literacy in the health workforce and the wider population, we are far behind. Related to governance on AI, that is something, a huge important challenge, and of course this is related to infrastructure. And finally, about monitoring and evaluation, something that perhaps we talk about a bit investments, but I think that one missing part for us to take note is about evaluating and monitoring what we are doing. Because I think that we are not doing enough too, right? So I'm really begging all of you, financing projects or working on something to ensure that you have proper measuring mechanisms. I don't want to call KPIs, monitoring frameworks, etc., but that we can really measure progress to make progress.
That's good reflection, David. Vera, how about you?
I mean, when I think about the region, I would say that our region still need a lot of support in strengthening the data layer. You know, that is the layer that still needs to be, and it's not just about collecting the data, you know, it's about the data availability, the data quality, access. Those are still the issues that I see within the ministry and, you know, outside of that scenario also. So I think that data layer and then that grounded in the DPI is what the region is asking for. And they're working towards that also. So that is where the demand is, and many countries, like I just recently saw that Pakistan has developed a Digital Health Act, and they're working on this DPI, and Jordan is advancing very much, focusing on data governance layer and focusing on the DPI through their medical records. So this is where I think that we need to focus on. Thank you.
And I think that's a really exciting example, because many countries start with that question of where do we begin? And I think in many settings, we've seen that the pivotal moment is when the government instills an act or a piece of legislation that codifies the strategy as something that's now deliverable to its government, to its people, as a necessary investment. So Kenya, for example, with its National Digital Health Act, we've seen similar initiatives across the African continent, across South America, where that piece of legislation then unlocks both the political and the financial resources necessary to make that happen. So a great example, Navira. Myrna?
Well, yes, the region of the Americas infrastructure is also very, very, very related with partnerships and development partners, because are they the ones that finance mostly the advance or the update of the infrastructure? And we have a lot of requests always or complaints on countries about, well, we have obsolete infrastructure to implement what they want, or you give us a few computers and we don't know what to do. These are the things that we always find when we go to the field, mostly. Because, well, of course, sometimes they have the computers and they do not have internet connections or even electricity. That's why universal connectivity is also one of the 8 principles, and I'm sorry that I repeat this. It seems the same, but it's not the same, because universal connectivity should be one issue also for health. Because when we go to the health sector says, well, but this is not our this is not under our scope. So this is under innovation, or this is under yes, ICT, no, or government, and not health. But coming back to the partnerships, I think that infrastructure updates in our countries is almost the same that we were talking about AI. Because when we update the technology, no, the infrastructure, we think on the infrastructure per se, and not for the use and for the benefit related to that. That's why when, well, the things come to the field, they don't know what to do, and they became obsolete or unuseful. So that is, in this point, I should say that, and you mentioned, Alan, the relationship that we have, the strong relationship that we have with IDB, which is a success. I think that is a success story because we go together to the countries with technical cooperation and with funds. So we provide together the thing that the other one cannot provide, maybe. And it's been 10 years and it's working, so I think that this is something that can be replicated with other partners. Also, talking about sovereignty, sovereignty is not only for AI or for data. Is countries are sovereign to say, I want to work with 2 or 3 partners together. You can do that, and we are willing to say yes, we can also, and we are able to work together with World Bank in our case, or with IDB, or with CAF. Yes, so I think that this is the approach. We can propose to the countries to do that, but the countries also can, when we sit to the table to negotiate, to say, we want to work with you together and not separately, because also it's a huge work for the countries to work separately.
Yeah. I think that's a really good point, and one that we increasingly emphasize is none of us is on this journey alone, whether it's WHO or the country itself. We work in partnerships, and I think that the partnerships with the development banks is a critical one, but also I know we have, Andy's here from WEF, we have other members of private sector. Those public-private partnerships are absolutely critical, and to some extent, the hard work that we discuss here, that WHO helps countries build the enabling environment in which private sector can thrive, in which entrepreneurs can build solutions that support the public sector goals. So I think that's a really important reflection on the role that WHO plays, not just in advancing health, but also in market shaping, because that's where the sustainability sometimes will come from. Benson.
Yeah, thank you. I started my work with WHO in Geneva. I think I was there for about 4 or 5 years. In my house, I used to pay 62 euros for internet, for telephone calls. With that, I could call all the countries in Europe and all the countries in North America at no extra cost. I had all the channels on television. I didn't care how many visitors I had in my house and how much internet they were using. In Africa, it's a totally different situation. You'll never go to a country, you'll be lucky actually to find a country that offers you that kind of package at that low cost. Internet in Africa is one of the most expensive commodities. In my house, I always have to check that my children are not using YouTube or any of those things, because they can burn the entire package in one day. That is the situation of infrastructure in Africa. We have challenges in access to internet, in access to computers, electricity. Many of you, I think, have done work in Africa. You know exactly the situation I'm trying to put here. I think that takes me back to the point Marina had just made. The conversation on how to improve digital infrastructure goes beyond the health sector. It has to go across. The ministry that lead the work on ICT is seated somewhere, electricity companies somewhere, so we need to bring all these people, I think, around the same conversation table. So I think one of the things that's limiting the deployment of all these tools in Africa, infrastructure, I think, is one of the major foundational missing pieces. I'll stop there, thank you.
No, thanks for that reflection. And so, welcome to my home. You can eat as much as you want, but don't download a Netflix movie. Very, very grounded in reality. So coming back to you, Karthik, I think, infrastructure in the Sierra region is one which comes up a lot, but particularly in the context of digital public infrastructure. And we'd love if you could say a few words about DPIs and how that plays a central role in moving from a fragmented past to a consolidated future.
Sure, thank you. I think in terms of the thinking, when we construct a house, we would always start from the foundations. And I think the digital public infrastructure as a word is certainly a new word, but I think the concept is pretty old. You start from very foundations, which is the physical infrastructure of devices, connectivity, other elements of infrastructure like data centers. You have that foundational layer, and then you have the foundational DPIs, which are identity, payment, and data exchange, which typically come from what Benson talked about, from typically the ministries of ICTs. And then the layer next is going to be the health-specific DPIs, which is drawn from the digital identity, the personal identity. You could convert that now into unique health ID and use that to link all your health records as patients move from primary, secondary, and tertiary. And then have registries, because across all programs, you will need, whether it is a facility registry, provider registry, drug commodity registry. That's the more of the health-specific DPIs. And then comes the topmost layer, which is the digital health applications. Very often, we've always inverted the pyramid. We always started first with digital applications without any of these foundations. And I think in that way, these foundations has been the fundamental key that's emerging in Southeast Asia. The second point that I wanted to just add is, while the concept is new, it's a very fundamental concept, because as people, even when we construct our homes, we always first go to an architect before we go to a civil engineer. So for me, it's more the architecture approach, and I think DPI as an approach truly speaks to that. The second thing that I want to highlight here is, Mirna talked about why it's important for a technical organization and a financial institution to work together. Add to that the public and the private. And Benson talked about the need for more of an all of a government approach, which is not just the Ministry of ICT, Ministry of Health, Ministry of Finance. You also need Ministry of Interior or Justice. What I want to just add as an additional layer, which is where, as WHO, we do well, which is the Global Initiative on Digital Health, which as a managed platform should now be the one which essentially enables countries to learn from each other. So how do we now leverage countries like, and more specifically in a country like, in a region like Sierra, you have a couple of countries which are slightly ahead of the pack, but how can they become learning centers, learning models for the rest of them? And that's where Guide as a platform, a regional platform which will help countries to learn from each other, is then going to be pivotal. So I would say, for example, while DPI as a concept is great when you see it work at scale, but then how can other countries learn from something that works at scale across multiple geographies? I think that's going to be the key thing for us, and how do we unlock that is going to be important.
Fantastic. So really, I think we've heard a lot from each of our regions here today. Huge diversity, but also shared vision, shared approaches and opportunities. Maybe just to say a few words to close us out, I'd like you to think for a moment on the last family holiday where you all went, you and your spouse and your children, if you have them, went off somewhere on a destination. When we talk about a digital health strategy, that's the vision of where we are going, the destination. The blueprint that many of us are struggling to have to make sure our countries have these blueprints in place is the plan. How do we get to that destination? The foundations that we talk about, the digital public infrastructure, the governance, the legislation, that's the roads, the highways that make sure we get to that destination, that are the enablers of that journey. And the systems that we talk about, that's the vehicle in which we ride. I think when we think about the family riding together, those are the stakeholders, because at the end of the destination, there has to be something for my kids to do and for my wife to look forward to after 3 hours of screaming in the car to make sure that we all get to the end together. But we're not on this road alone, and we share the road with many other cars. So we learn from good drivers and bad drivers, we learn from those who go fast, and we learn from those who are behind us on the highway. So I want to really thank all of our panelists for first of all, their dogged hard work day after day in support and service of you, the member states, of the stakeholders in the audience who work to support countries in getting to where they're going, and really appreciate your insights, thoughtful comments, and reflections. And thank you, the audience, for listening so patiently and carefully to this work. We're here to support you, and thank you so much for your partnership.
Thank you very much, Alan, and also to all the colleagues from the regions for your honest insights and perspectives. It is my pleasure to hand over the microphone to David Novilho Ortiz, Regional Advisor for Data, AI and Digital Health, WHO Europe, to give us an outlook on where we go from here. David, you have the word.
I'm going home, I don't know. Thank you so much, and good afternoon, colleagues. It has been a very, very intense week, even though some of you have been part only of the last 2 days. It has been a very, 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 very good week. We have had 37 countries with us. We were talking at the beginning, right, among the challenges, disagreements that we could find. And what we have is a lot of agreement, actually, so that is great. And this is a clear direction for us. Something that has been particularly important for us, for WHO, for the regional office in Europe, is that we always hesitate to organize meetings, right? Because everybody's concerned. Organizes meeting because you don't know, okay, another meeting more, right? Why I'm particularly proud about this event. This event has not been about WHO telling you what you need to do. It has been random experts telling us what we need to do. It has been about you telling us what we need to do. And I think that is the main difference with other events that I have been attending over the year. Of course, I am biased because also this one was organized by us. 3 particular messages that I would like to share that we have captured during the day is that clinicians and patients should remain at the center. That is something that we know and we need to continue saying, and this is something that you are reinforcing us, so it's very good to know from you that this is also a priority as part of your agenda. We also know that no single country can solve this alone. That is absolutely clear. This is an area in which we still need to continue working together for a long time, and we look forward to being part of the journey along with all of you. And the last message is that we were talking in the investment plenary about one country, one plan, and I think that is great. I think that we should follow you and your leadership. We're working on this. And all of us, multilateral partners, development banks, anyone that can contribute to this effort should play around this effort. So it's you who's taking the lead as part of this. Next steps, particularly for the European region, are a roadmap that will be adopted hopefully in October, later this year. It will be our compass on AI for the European region. And at the global level, I am pretty sure that Alan will talk about it, about the next global digital health strategy. It's going to be amazing to have this global compass too. And I would like to conclude giving thanks to our wonderful host, Portugal. Thank you so much to the Minister Ana Paula Martins, and of course to the Secretary for Economy, Joao Rui Ferreira. Thank you so much for hosting us and for making always feel that we are at home. Also, as an Spaniard, is how I feel. Also, thanks to all of you, ministers, colleagues, partners, to making the time in the middle of August. I know it was a terrible idea to organize something in the middle of August, so it means a lot to us that you came all the way here to continue the discussion and the roadmap. And finally, I would like to thank all the colleagues have traveled all across the regions, my 6 colleagues, plus Alan. It's always a pleasure working under the direction that you are all helping us to have when it's about this area work, and your wonderful team. And last but not least, of course, my wonderful team. They have put a lot of effort to have this done, particularly my colleague Helen. Thank you so much. I know that my popularity with them is quite low at the moment for organizing this in mid-July, so I cannot thank you enough for being such a wonderful team, and it's a pleasure every day working with you and learning from you. So thank you, colleagues, and this is all from me. Thank you.
Thank you so much, and I think nobody could sum up better than what David just did, but I will take the opportunity because, Excellency, we're delighted to have you, and thank you also from WHO HQ to Portugal for its hospitality and the fantastic food, friendship, and climate that you've offered us during these few days. Often the person standing at the podium doesn't get the thanks they deserve, so I want to give a round of applause to David, who's led this team, and recognize the hard work that it's taken. So to everyone behind the scenes, to the folks who have been running the systems up there, who have kept us fed and housed and moved from one building to another, thank you all for the hard work that you put in making this possible. And without further ado, it's my privilege to give the podium to Excellency Secretary of State for Economy.
So, good afternoon. First words to congratulate all the team. I see that it's been a good event and a good week, and I hope we have provided all the good conditions. So, facilities, everything, good food, as you mentioned, and the weather, we tried the best we can. But AI still cannot at least guarantee good weather, but we are in a very good position. The second word is to thank the invitation, to tell you that we are here not just because we are part of the government to be institutional, but because this is clearly key, as I will address up to you, for the development of our country, economy, and Portugal as a member state in the European Union and in the world. We think this will be will play a very important role. Last word to the introduction is that as a failed doctor, and I tried medicine, it was my dream. So then I became chemical engineer and now Secretary of State of Economy. So it's a big mess, but I will try to, everything that it's linked to health, I think really touches us in a different way because we are dealing with something that is intangible. Everyone in front of a doctor, we feel, it's a different moment, but in the end of the day, this is also part of the economy, as you can see. I know the Minister has been here, and we have a national strategic vision for AI. We are developing a national strategy for AI. We have developed and we are presenting. It's changing the way public institutions are acting. We are introducing AI in many of our institutions, in our processes, action plans, in order to be much more effective, fighting bureaucracy, able to answer to citizens and institutions in a much better, fast way, predictable. We are seeing also that transformation in companies and, of course, in our daily lives. Actually, the minutes of this meeting I received with AI, that allowed me to have a full perspective of what has been discussed. But we are seeing, and we look at artificial intelligence as an economic driver, both in the way that companies that will adopt AI will be much more efficient, much more productive, let's say at an administrative level, in the office to be more clear in all these office operations, but also in the shop floor, in the way we transform ideas into processes and services. To tell you, we are also at the same time having in Lisbon an event, the Summit of Research and Innovation, that today we have a single agency that covers all the chain of innovation. So from research and scientific institutions to the innovation and knowledge transfer. And of course, AI is becoming a very concrete part of what is happening. And as I said, in the shop floor, how can we transform ideas into new products and services? And how can we put that at the service of the country to add more value for what we produce? So Portugal is a small country and a small economy, let's say not a small country at the European level, a middle-sized country, but a small economy. So typically companies, from day one, they start looking globally, because starting by exporting and then internationalization is what companies need to do. And this is much more real when we are at the startup level. So since the day they start, they look globally to export, to expand their business. We are also seeing that this is transforming from pilots to real economy. So, of course, everything we have, it was in the first moment, pilots, projects, prototypes, simulations, and now we are seeing the deployment of this to the real economy. So becoming a real part of our manufacturing ecosystem, putting together the most mature Portuguese industries with the most cutting-edge technologies that typically come from startups, from different sectors. And so it's being very, very interesting how we are seeing that these, let's say, competencies are becoming real. And Portugal is really well positioned on this. Portugal today ranks number 3 in Europe in STEM graduates, especially in engineers. So we have a very good capacity to also perform, manufacture, develop many of these applications. We are number 6 in the world in a very large study conducted by Education First, a Swedish company with a sample over 12 million people. We are 6 in the world in the English proficiency, which makes Portuguese companies very, very adaptable and able to connect culturally, integrally with other nations, and making this easy to connect. We had in 2025 the record of having 5,000 startups registered in the Portuguese economy, and so the impacts are being seen in the real life, and it's becoming very, very exciting to see that our intangible conditions, food, the way we live, weather, that's for some people it's good or bad depending where you come from, but typically I think everyone now is trying to find a cool weather. We complain a lot. I'm from Porto in the north, and many times of the year we have a lot of wind and it's a bit cold, but now it's becoming very comfortable because everyone is facing terrible change, but I don't want to enter in the climate change discussion. So it's a real example how, and when we enter in the healthcare and innovation, if it's vibrant when you see it globally, when you enter in this specific team, is unbelievable what's happening. We have companies like Sword Health, Uphill, Prompty Health, AI for CMR, and others, and I'm seeing a lot of test beds, startups performing in this area. The Portuguese health cluster is doing very, very well. And the big transformation we see is that the companies are, of course, large companies, large players have been always in Portugal, in medicines, in pharmaceuticals, in point-of-care devices, in medical devices for technology. But we were a country as a market for these companies, and now we are seeing that we can be part of this technology in the way that we can produce components or devices or software to these large-scale companies, but as well developing our own systems. Additive manufacturing, we are seeing amazing things on the tissues, on the cells, in development. So biotech as well and life science, very, very important. Actually, we launched, and the Ministry of Economy, a program called STEP. It's the Strategic Technological European Platforms, which is one of the pillars are biotechs and life science. And we have seen, it's a program of 1.1 billion euros and a lot of demand when we are in the biotech areas. And that shows that we have the knowledge, the competence, the capital, and the willing to do different. And so we had also the mobilizing agendas. That was a program under our PRR. And these agendas were large consortiums that put together academic institutions, interface institutions with companies, and the way to measure the success was not in terms of expenditure, so not receiving a grant or a subsidy or a subvention for an invoice or for an expense, but it was for achieving a product, a process, or a service. And we are seeing it happening. We had 2 weeks ago the demonstration, and it was very, very important what we have seen with a strong support from the public, with public investment, but having also a very interesting private already ecosystem, especially in devices, in many solutions that even for us was a big surprise. What is coming next? What are we seeing? And we are working strongly on that. Interoperable data. When I arrived, I arrived 20 minutes ago, 15 minutes ago, and there was a delegation from São Tomé e Príncipe leaving, from the national system of São Tomé e Príncipe. São Tomé e Príncipe, it's an archipelago, islands that in Africa, and I was discussing with them the potential of this. And in 30 seconds, 1 minute discussion, it was impressive. Imagine how can we improve the quality of life of citizens, the diagnosis, not only how to diagnose a patient, but then you can treat it, how can you do it at distance, in very difficult conditions, and the beauty of this is that improving the quality of life of everyone in the world. We have seen the panel that I was explained that these were the leaders from the different areas of the world. And in the end, you mentioned, there is a large consensus and an agreement among all. Of course, we have challenges. We have challenges of the ethical, the data, how this should be developed, deployed. But I think the benefits are much bigger than the challenges and risk that we have in front of us. And then, of course, I see a couple of people that I know. I think Ricardo Batista is there. He's a doctor now. He was very present during pandemics, and every time there is difficult things, he comes up. But many of you are doctors, I know. And I think in our country, at least in Portugal, our citizens are very sensitive to the health care system and to what happens in the health system in general. For different reasons, also because the demographics, the population. My brother is also a doctor. I have a lot of friends that are doctors. My colleague from Science and Innovation, the Secretary of State, is a doctor, so I'm in a world of doctors. But it's very, very present in our quotidian. You see in the news. It's something that really touches the people's life. And many times, public services are judged in the way they can perform better or worse, and in hospitals and clinical, and it's very clear. Shortening waiting times, early diagnosis, better use of resources, because it's an heavy consumption of resources, of course. Financially sustainable healthcare systems, improved quality of life citizens. So all of this can be highly impacted and be improved with the use and the access to AI. So the question is not simply how we shape AI in health. The real question is how we use AI to shape healthcare systems that are more sustainable, more productive, and more accessible for all. I think this was the key of the discussion. This is not a single member state problem. This is not an European level problem. This is a global question and a global problem that from times to times citizens all over the world understand that what happens in a part of the world can really impact what happens here. And many times we only take care of that when bad things happen. So let's take care of the things when we are in a good moment to find the solutions, to be prepared if something goes wrong, we can act. So look our country not only with intangibles, but also as a huge potential to develop solutions, to find the right talent, to continue to work together with you. And I wish you all the best for the final next Sunday, and some for the Argentinians in the room, if there are some. I understood. I was in doubt. I didn't get if you were saying Botecha or non conseil. But at the same time, actually, I was talking with the Portuguese ambassador in Buenos Aires, where I have been quite recently. And so my heart is a bit divided, so I don't have any options. And I don't regret, there are no hard feelings David, that's what it is. You deserved it. And for the ones that stay in Portugal, I wish you a good stay. For the ones that leave Portugal, I wish you a safe trip. Keep Portugal in your heart. I'm sure you have, but please keep it in your mind as a place of innovation, research, added value, and where you are always welcome to discuss local problems, but mostly global problems. That's what we should looking for, because in the end of the day, the Earth is a global condominium. Thank you.
Thank you very much for these closing words, João Rui Ferreira, and the commitment to keep up with the joint efforts. On behalf of the organizers, I would like to thank all of you who joined us here for the Global WHO AI Conference, Shaping AI in Health. Thank you to all the speakers, panelists, and moderators for sharing your perspectives. Over the past 2 days, we heard inspiring conversations that are to be continued. Now, we wish you a pleasant evening and a safe journey home.